Hello everyone. A very good morning to all of you. Am I visible? Am I live? Can you see me? Can you hear me? Give me a minute to confirm if I'm clearly visible, audible. I will start the class ahead. Let me confirm. Yes, I guess it's working. I guess. Just a second. Give me a minute to see whether I'm clearly visible, audible. Yes or not. Yes, I guess it's working. Yes. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I'm here to take a series on mnemonics. Yesterday we have started the series. We have taken the mnemonics on bacteriology. So today I'm going to give you multiple new exciting mnemonics on the entire parasitology. Now many students find this parasitology in the microbiology very difficult to understand. So of course, if you understand, it is very volatile. So in the exam, when questions are coming from parasitology, many students do silly mistakes. So to learn it for a better retention, you require mnemonics, right? So here I will give you many mnemonics from the entire parasitology. So let me start. Okay. Before starting the mnemonics of the parasitology, you should know the classification of the parasitology. So when I will give you any mnemonic, the mnemonic will contain the multiple parasites. So you should have an overview that which parasites belong to which category of the parasites overall. So you should know a thorough classification of the parasites. So in the first 5 minutes of the lecture, I am going to teach you the classification of entire parasitology. After that, we will start mnemonics one by one. I'm having more than 50 to 60 mnemonics today to give you in the entire parasitology. Now, believe me, if you understand all these mnemonics, if you understand all these mnemonics, if you learn all these mnemonics, I can guarantee you can crack all the MCQs, maximum MCQs from parasitology in your exam with very ease. Okay, let me start. So what is a parasite? I guess you can understand what is a parasite. So this is a human body, or this is any organism. Parasite is the organism which reside inside another organism. So this is a parasite. The parasite is the organism which obtain food and shelter from another organism. The another organism is known as host. The another organism from which parasite is obtaining two things. Parasite resides inside host for obtaining food and for obtaining shelter. So the organism which resides inside another organism for obtaining food and shelter is known as parasite. The another organism which is providing food and shelter to the parasite is known as host, right? Now parasite cause harmful effect to the host. Not only it takes food and shelter, it takes food and shelter from the host, but on the contrary, it gives harmful effects to the host. It causes diseases to the host. You got my point? So this is the definition of the parasite. Parasite is the organism which obtain food and shelter by living on another organism, which is known as host, and causes harm to the host. Give me a thumbs up if you got the definition. Now, in parasitology, we divide the parasites into two categories, protozoa and metazoa. What is the basic difference between them? Protozoa are unicellular parasites and metazoa are multicellular parasites. Metazoa are also known as helminths. They are also known as helminths. So we have basically two groups to study, protozoa and metazoa. Protozoa belong to the kingdom Protista. So whenever I say protista in parasite, I mean protozoa. So protozoa, protista, one and the same thing, and metazoa and helminths are one and the same thing. These are unicellular organisms. These are much developed multicellular organisms. So that is the first level of classification you should understand. Protozoa, metazoa. Protozoa and metazoa, the two categories. Now coming on protozoa. Protozoa, the first I will teach you the classification of protozoa, then I will come on classification of metazoa, and after that I will start with the mnemonics. Protozoa are divided into 5 categories, metazoa are divided into 3 categories. To learn the basic classification, first divide them into unicellular, multicellular, protozoa, metazoa. Protozoa also known as protista, metazoa also known as helminth. Okay, now start with protozoa. Protozoa are divided into 5 categories. What are the 5 categories? Amoebas. Amoebas are known as amoebas because they do not have any fixed shape. The shape is like a slipper. Can you see this is the shape. They have pseudopods. This is the amoeba shape. Flagellates are known as flagellates because they have flagella, multiple flagella on the body of the parasite. You will find flagella. Sporozoans are known as sporozoans because they have spores inside them. That's why they are known as sporozoans. Ciliates are known as ciliates because they have cilia on their body. They have cilia on their body, and microsporidia are known as microsporidia because they have microspores inside them. So we divide the protozoa into 5 categories. First learn the classification, so that if I give you any mnemonic now, you will understand that this parasite is coming from which category. Students even don't have concept ki ma'am this parasite is a protozoa and this parasite is a metazoa. Broad you should divide कि protozoa कौन से हैं, metazoa कौन से हैं, unicellular कौन से हैं, multicellular कौन से हैं. In the protozoa, out of the 5, which category the parasite is belonging? So we have 5 categories. What are the 5 categories? So protozoa, metazoa. I'm dividing protozoa and metazoa. Let me talk about protozoa. The protozoa is further divided into 1, 2, 3, 4, 5 categories. What are the 5 categories in the protozoa? The 5 categories in the protozoa, it is amoebas, it is flagellates, it is sporozoans, it is ciliates, and it is microsporidia. Sporozoans and microsporidia, both are spores, learn together. Sporozoans, microsporidia, and flagella or ciliates एक जैसा है. So flagella and ciliates, apart from it amoeba. So learn like this. There are 5 categories. Okay. Now inside each category, learn the name of the parasites inside each category. Let me start with amoebas. Amoebas में total कितने amoebas हैं? Amoebas are further divided into 3 classes. Can you see the 3 arrows? So these are the amoebas. Amoebas are divided into 3 categories. The only one amoeba which causes disease in human is Antamoeba histolytica. Only one amoeba which causes disease in human is Antamoeba histolytica. There are 3 free living amoebas. They also cause disease in human, but they are not residing inside host body. They reside inside soil, air, water. That's why free living. So there are 3: Naegleria floweri, Acanthamoeba, and Balmuthia madralis. So these 3. So total 4 amoebas are in your syllabus. Non-pathogenic are commensals. They do not cause disease in humans, so don't learn them. Just read the name, but don't learn them. So pathogenic are only 4. The one is actually pathogenic, and the 3 free livings are pathogenic. So there are 4 amoebas which are important. Apart from it, these all are commensals. So Entamoeba coli, Entamoeba gingivalis, Entamoeba disper, Entamoeba hartmanni, and Andolix nana, and Idoamoeba buschelli. You can see these are commensals. They do not cause disease in humans, right? So these are the amoebas. Okay, amoebas are done. We divided amoebas into 3 categories. Pathogenic, only one. What is that pathogenic amoeba? Antamoeba histolytica. Free living, the free living are 3. Naegleria floweri, Acanthamoeba, Balmuthia madralis, right? And the commensals are many. Don't learn the names, just understand. These are commensals. Let me come on flagellates. We divide flagellates into 2 categories. Can you see the 2 arrows? These are the 2 categories. The flagellates which reside in blood are known as hemoflagellates. The flagellates which reside in either intestine or oral cavity or genital cavity, these are non-blood. The one which reside in blood, the one which resides in non-blood. Non-blood में क्या क्या? Intestine, oral or genital cavity, right? Hemoflagellates दो ही हैं. Both are must important, very important. Leishmania and trypanosome. Now T सारे consideration में लेना. Entire parasitology में multiple T वाले parasite हैं. You will have confusion in the mnemonic ये T, in the mnemonic कौन सा T है. So it is trypanosome, which is a flagellate. Hemoflagellate 2 हैं, Leishmania and trypanosome, right? Intestinal, oral, genital में Giardia lamblia. There is Giardia lamblia, Trichomonas. These 2 are important. So learn other 4 also, but 2 plus 2, 4 are important here. So Giardia lamblia, यहाँ पे भी T है. This T is Trichomonas and this T is trypanosome. So learn these 4 in the flagellates. So after from the flagellates, we have divided the flagellates also into 2 categories. The hemoflagellates, intestinal, oral और genital flagellates. Hemo में भी 2 हैं, Leishmania and trypanosomes. और intestinal, oral, genital में भी 2 हैं. What are the 2 there? Giardia lamblia and Trichomonas. So ये trypanosome है, ये Trichomonas है. So both T, pronounce them clearly. Trypanosome, Trichomonas, without any confusion, both are flagellates. But one is blood, one is intestinal, genital or oral. Give me a thumbs up. Give me a thumbs up. Coming on the third category, sporozoans. There are many sporozoans which are important, but in your syllabus, I guess these 3 are important. Plasmodium, Babesia, and Toxoplasma. Plasmodium, Babesia, Toxoplasma. Learn others also. It is Sacrocystis. Now, sporozoans have spores now. So, Isospora, Cyclospora, Cryptospora. See the word spora, spora, spora. Spora means sporozoans. So, you can learn like that. So Plasmodium, Babesia, Toxoplasma ऐसे ही learn कर लो. इसके अलावा 3 spora हैं. So that is about the sporozoans. You got my point? Coming on ciliates, only one ciliate is there. Valentidium coli. That's it. Only one. This is the among all protozoa, among all protozoa, This is the largest protozoa. Not only among protozoa, among the protozoa, this one is the largest protozoa. इस पे MCQ आता है, and only ciliated one. Cilia एक ही के पास है. The answer is Balantidium coli. It is a very important MCQ. Balantidium coli पे 2 MCQs आते हैं. Number 1, it is the largest protozoa among all protozoa, and it is the only ciliated protozoa. Only one ciliated protozoa. Balantidium coli. The last one is Microsporidia. इसमें भी सिर्फ एक ही organism है, Microsporidia. That's it. That's it. Microsporidia. So I am done with protozoa. Let me revise you again. I am teaching you the classification of parasitology. So in parasitology, we divide the parasites into 2 categories. So the unicellular ones are known as protozoa, and the multicellular ones are known as metazoa. Metazoa are also known as helminths, right? And protozoa belongs to the kingdom Protista, right? Okay. Now protozoa are further divided into 5 categories. What are the 5 categories? Lavanya, have you got it? What about others? I can't see your names. So what are the 5 categories? The 5 categories are, can you tell me the 5 categories? Let me take another page. So let me take another page, protozoa. Protozoa. Okay, just a second. Protozoa. Just a second. Give me a minute so I can change the color of the pen. I have to run a script for it. Give me a minute. Let me escape and come again. Give me 1 second. It will hardly take 1 second. Just a second. I have to run a script for changing the color of the pen. I can't change the color right now. Okay. I guess I can do it right now. Let me start. Here I am. Can you see my screen now? Let me see if I can change. Yes, I can change the color of the pen now. Okay, so I am teaching you first protozoa. Then we will come on metazoa also. So protozoa. Okay, so I am teaching you protozoa classification. Protozoa are divided into 5 categories. Can you tell me the 5 categories? What are the 5 categories of the protozoa? Yes, Lavanya, very good. Yes, Mamta, very good. What are the 5 categories? Tell me the 5 categories. Number 1, amoeba. Amoeba. Number 2, what is after amoeba? After amoeba, we have flagellates. Flagellates. After that, we have sporozoans. Sporozoans. Right? After that, we have ciliates. And in the end, we have microsporidia. Can you complete the classification? Any of you, can you help me in completing the classification? Yes, Sakshi, tell me how many amoebas are there. We divide amoeba into 3 categories. The pathogenic one, the free living one, and non-pathogenic one. In our syllabus, only important are pathogenic and free living. Non-pathogenic one are common cells, don't learn that. So can you tell me the name of pathogenic one? Only one amoeba. Only one amoeba. Yes, Sakshi, Lavanya, Mamta. So only one amoeba is pathogenic. It is, what is the name? Antamoeba histolytica. Antamoeba histolytica. Free living are 3. Naegleria floweri, Acanthamoeba, Balmuthia madralis. So these are the 4 amoebas in your syllabus. Non-pathogenic are many, but all of them are common cells. Right. Coming on flagellates. We divide flagellates into how many categories? The 2 categories. Yes, very good, Sakshi, Lavanya. What are the 2 categories in flagellates? The one which reside in blood are hemoflagellates. The one which reside in intestine, oral cavity or genital cavity are non-blood. Right. So in intestine, genital cavity or oral cavity we have 2. In hemoflagellates also we have 2. So what are the 2 in hemo? Hemo में कौन से 2 हैं? Leishmania and trypanosome. Leishmania, this T is trypanosome. And in intestinal, oral and genital, again we have 2. What are the 2 here? Giardia lamblia and trichomonas. Now see the 2T, trichomonas and trypanosomes. So both of them are flagellates. Coming on the next category, the 3rd category, sporozoans. Many important sporozoans are there. In your syllabus, you can say 6. The most important is Plasmodium. The second most important is Babesia. The third is Toxo. Now see the T. Again, T, T, T. Mnemonics में T आएगा तो you have to understand ये T कहाँ का T है. It is toxoplasma. It is toxoplasma, right? Plasmodium, Babesia, toxoplasma, and the 3 sporas. Cyclospora, Cryptospora, Isospora. Isospora, Cyclospora, and Cryptospora. Cryptospora. Sporozoans में spora, spora, spora. Done. Coming on the 4th category, that is ciliate. Only one ciliate is there. Microsporidia, only one microsporidia is there. So tell me the name of one. Ciliate is only one, Balantidium coli, which is the largest one. Among all these, this one is the largest parasite, the largest protozoa. In the microsporidia, it is the microsporidia only. That's it. I am done. Everyone give me a thumbs up if you got the classification. Classification of protozoa. Classification of protozoa. If you got the classification of the protozoa, let me move on the classification of metazoa. After that, I will immediately come on the mnemonics. Let me start Metazoa, the classification of the Metazoa or helminths, right? I told you that we divide entire parasitology into two categories. The unicellular one are the Protozoa, the multicellular one are the Metazoa. I already taught you the 5 classes of the Protozoa. Now I'm teaching you 3 classes of Metazoa. We divide Metazoa only in 3 classes, not 5. So what are the 3 classes of Metazoa? Cystodes, nematodes, trematodes. That's it. Cystode, nematodes. So let me start Metazoa or helminths. Yes, very good, Sakshi. So Metazoa or helminths we divide into 3 categories. Nematodes, cystode, trematode. Nematode, cystode, trematode. Nematodes are cylindrical in shape. That's why known as roundworm, like earthworm. They are cylindrical. Cystodes. Cystodes are flat, like a sellotape. Have you seen a tape, sellotape, inch tape, sellotape? It is like a flat, like a tape. That's why known as tapeworm. Tape means inch tape, inch tape. And trematodes, the trematodes are like shape of a leaf. That's why known as fluke. Fluke का मतलब होता है leaf. Give me a thumbs up if you got it. So roundworm, tapeworm, flukes. So basically, we divide Metazoa, also known as helminths, into 3 categories. What are the 3 categories? Can anyone of you tell me the 3 categories? The 3 categories are nematodes, cystodes, trematodes. Right? Nematodes are cylindrical, that's why known as roundworm. Cystodes are flat, that's why known as tapeworm. And trematodes are leaf-like, that's why known as flukes. Give me a thumbs up on this point if you got this point. Should I proceed? Now listen, everyone listen to me. Everyone, I will divide each of them nematodes into 3 categories, trematodes also into 3 categories, but cystodes only in 2 categories. So what are these categories? Either they reside in intestine, or they reside in tissue, or they reside in blood. So intestinal nematode, tissue nematode, blood nematode. Right, here also trematodes. They reside in intestine, they reside in tissue, they reside in blood. Give me a thumbs up. But cystodes don't reside in blood, either intestine or tissue. That's it. Give me a thumbs up. So you can see here the nematodes I'm dividing into 3 categories. What are the 3 categories? Intestinal one, tissue one, blood one. Same cystodes or trematodes I'm dividing into 3 categories. Intestinal one, tissue one, blood one. But in cystodes only 2 categories are there, intestinal and tissue. Cystodes don't remain in blood. Cystodes में blood नहीं होता है. So total 1, 2, 3, 1, 2, 3 plus 2. So 3 plus 3 plus 2. So total 8 categories are there inside which. Give me a thumbs up. Everyone give me a thumbs up. Everyone. Let me start with nematodes. Let me start with nematodes. So what are the 3? No, nematodes सबसे बड़ा है. Cystodes को complete करते हैं. Cystodes में only 2 categories are there. The intestinal one and the tissue one. Right, यहाँ पे काट दो. It is the intestinal one and tissue one. So intestinal one, we have 4. The 2 tinea, tinea solium, tinea saginata. The one H nana and diphyllotum latum, D latum. Tinea solium, tinea saginata, H nana and D latum. These are the 4 intestinal one. Tissue में एक ही tissue है which resides in the viscera of the dog, of the sheep. That is Echinococcus granulosus, the dog tapeworm. This one is known as dog tapeworm. You know it remains in dog. It causes hydrated cyst. So only 5 cystodes are there, the tapeworms. So we are done with cystodes. Now come on trematodes. Trematodes में we have 3 categories as I have told you. The intestinal one, the blood one, the tissue one. So let me complete. Intestine में सिर्फ एक ही है, fasciola busci. The word busci means intestine, right? Blood में भी एक ही है, cystosoma. Tissue में 2 हैं, the one in liver, the one in lung. The 2 tissues. In the liver it is fasciola hepatica. ये भी fasciola था लेकिन busci. ये fasciola hepatica है. और lung में paragnomius westermani. So only 4 trematodes in your syllabus, only 5 cystodes in your syllabus. 4 trematodes, 5 cystodes. Not the nematodes are the longest one, the biggest one, nematodes. So there are intestinal one, there are tissue one, and there are blood one. Let me start with blood. Blood में 4 हैं. Wucheria bancrofti, right, which causes elephantitis. Brugia malai, loa, which causes conjunctivitis in the eye, and onchocerus volvulans, right. Tissue में 2 हैं, trichinella and dracunculosis. Trichinella spiralis and dracunculosis medianus. And intestinal में 6 हैं. What are the 6? So 6 plus 2 plus 4, total 12 nematodes in your syllabus, right? You have to learn it, right? Antrobius vermicularis, Trichura trichuris, Ascaris lumbricoids, Necator americans, Ankylostoma duodenale, and Strongyloids turpolis. So these 6 are the nematodes. Okay, let me summarize. It is confusing, I know. So let me teach you nematodes. Nematodes, also known as, I'm sorry. Let me teach you Metazoa. Metazoa also known as helminths. Give me a thumbs up on this point first. Metazoa also known as helminths. We divide Metazoa into three broad categories. Three broad categories. I will start with cystodes. Then I will move on trematodes. In the end, I will tell you nematodes. Write down their other names. What are their other names? Cystodes are flat. That's why known as tapeworm. Right? Trematodes are leaf shaped. That's why known as flukes. And nematodes are cylindrical. That's why known as roundworm. If you have learned their other names, come on further classification. We divide cystode only in two categories. What are the two categories? The intestinal one and the tissue one. There is no cystode which reside in blood. Trematodes we divide into three categories. Who will tell me the three categories? The intestinal one, the tissue one, but also we have blood one, the blood one. Nematodes also we divide in same three categories. The intestinal one, the tissue one, and the blood one. Now tell me the total number, their total number. So in cystodes, 4 plus 1 total 5 cystodes. You have to tell me 5 names. 4 names here in the intestine, 1 in tissue. Right? That's how you have to complete cystode first. Tell me the name of the 5 cystodes. We will complete cystode, then we will move on trematodes, and then we will move on nematodes. Tell me 5 cystodes. What are the names? The 2 tinea. Tinea solium, Tinea saginata. The one echinana and Diphylodon latum. Learn like this. The 2 tinea, Tinea solium, Tinea saginata. Very easy. Then echinana and Diphylodon latum. Right. Coming on the tissue, the only one, dog tapeworm, Echinococcus granulosus, which lies in the viscera of the dog. The viscera of the sheep, viscera of the dog, Echinococcus granulosus. That's why. That's how you have 5 cystodes in your syllabus. Give me a thumbs up. Sakshi, Payal, Lavanya, Shri. Everyone give me a thumbs up. You got my point? So the 5 cystodes are done. Can you tell me how many trematodes we have? In the intestine, only 1. Okay. In the blood, only 1. Okay. In the tissue, 2. So total only 4 trematodes in your syllabus. Tell me the name of the 4. Intestine में एक ही है, blood में भी एक ही है. Intestine में जो blood में एक ही है, what is the name of the blood one? Cystosomiasis. Cystosomiasis. That's it. Intestine में fasciola busci. The word busci is intestine. In the tissue, fasciola hepatica. Both are fasciola, but one is busci. The busci is in intestine, and hepatica is in liver. Liver is a tissue. And in the lung, we have Paragnomius westermani, which is in the lung. So the four trematodes are fasciola busci in the intestine, cystosomia in the blood, fasciola hepatica in the liver, and Paragnomius westermani in the lung. Give me a thumbs up. Very good, Sakshi. Very good. Coming on the nematodes. How many nematodes are there in your syllabus? Okay. The biggest one are the intestinal one. They are 6 in number. So even I got confused sometimes in them, but I will try. Okay. The tissue one. Let me think only 2 tissue one are there. In the blood, there are 4. 6 plus 2 plus 4, total 12. Tell me the name of 12 nematodes. 12 nematodes in your syllabus. Who will tell me the name of the 12 nematodes one by one? Let me start with blood. Blood में 4 हैं. Tell me the name of 4. I found them very easy. I will start the blood one. Wucheria bancrofti. Right? Wucheria bancrofti, which causes elephantitis hathi pair. Right? The second one is Brugia malai. The third one is Loa loa. Right? And the fourth one is Onchocerus volvulans. Give me a thumbs up. Give me a thumbs up. The tissue one are only 2. The one which reside in the muscle, that is Trichinella spiralis. The one which reside in skeletal muscle. And second one is Dracunculosis medinensis. जो हमारा मेडिकल का प्लस साइन होता है, on the plus sign the worm is Dracunculosis medinensis. You may have seen a worm on that plus sign होता है ना, the medical plus sign. So there is always a worm on the sign. If you have noticed, this worm is this one, Dracunculosis medinensis. Give me a thumbs up. Now come on the name of the 6th intestinal one. I will try. Even I get confused, but I will give a try. Okay, let me start with Antrobius vermicularis. ठीक है. The second is Ascaris lumbricoides. Okay, then Necator americans Ankylostoma duodenale. ठीक है. Then Strongyloids stercolus and Trichinella trichinellans. Oh my God, I have done it. Very good. I am proud of myself. So, okay. So total 5 cystodes in your syllabus, 4 trematodes in your syllabus, and 12 nematodes in your syllabus. So these are total classification of Metazoa. Now the classification is done. Let me start the mnemonics now. So the complete nematodes, Metazoa is in front of you. The nematodes, the 12 nematodes in front of you, the cystodes, the 5 cystodes in front of you, and the trematodes, the 4 trematodes in front of you. These one are in your syllabus. Everyone give me a thumbs up. So do you have, any one of you have any doubt in the classification? So tell me the broad, not all parasites. Tell me the broad classification of parasitology. Parasites we divide into which categories? Lavanya, Subhash, Sakshi, Payal. Tell me, we divide the parasites into 2 categories. The unicellular ones are known as Protozoa. Okay, also belongs to the kingdom Protista. So protista या protozoa, one and the same thing. And the multicellular one are known as metazoa. Metazoa are also known as helminths. Now tell me their further categorization into how many categories you divide them. So we divide protozoa into 5 categories. Amoebas, right? Amoebas is the first category. Flagellates, the second category. The third category is porozoans. Porozoans. Fourth category is ciliates. And fifth category is Balantidium coli. That's it. In Metazoa, we divide them into 3 categories. The first one is the cystodes, the second one is the trematode, and the largest one are the nematode. Now, I'm not repeating again inside each of them how many parasites you have to learn, but the parasites, the name of the parasite should be at the tip of your tongue. In how many categories further we are dividing them? Okay, you want me to tell? Okay, in a minute I will complete. Amoebas we divide into 3 categories, the pathogenic one, the non-pathogenic one, and the free-living one. You want me to say the names or you know? I guess you know. Flagellates we divide into 2 categories, hemoflagellates which resides in blood, and intestinal, oral or genital flagellates. Sporozoans, there are no categories, but there are many sporozoans: Plasmodium, Babesia, Toxoplasma, the 3 sporas, Cyclospora, Cryptospora, you know the sporas. Ciliae, only one ciliates, Balantidium coli, right? And Microsporidia, this one is, I'm sorry, this one is Microsporidia. Microsporidia, only one Microsporidia we are having, that is Microsporidia. That's it, that's it. In the Metazoa, we divide cystodes only in 2 categories, the intestinal one and tissue one. Trematodes into 3, intestinal, tissue, blood. Nematodes also into 3, intestinal, tissue, blood. I'm not saying the name of the parasites again. Just now I have finished. Now, if you have a thorough knowledge of the classification of complete parasitology, now you can understand the mnemonic. Now, before starting the mnemonic, I would like to give you advice to you. My advice, not to follow or not, it's your wish, but it's my job to give you. I'm your well-wisher, so I will give you a good advice. So take a big sheet, draw this complete classification on big sheet or big paper, right? Take A4 size paper, A4 size sheet, and draw the complete parasitology classification as I have written in front of you. The parasite, the 2 categories, protozoa, metazoa. Write all protozoa at one place with the name of the parasites inside them, and write all metazoa at one place. Now, if you have completed, you will say it's a easy job, ma'am. Okay, what's next? After that, I will teach you, take multiple color pens, right? The red, green, blue, orange, purple. Now, whenever I am teaching you the mnemonics, so just suppose the first mnemonic, tell me the name of the parasites which spread by sexual route. So इसमें से कुछ प्रोटोजोआ में से होंगे, कुछ मेटाजोआ में से होंगे. So mark with that one pen and write the color coding. The red pen I am marking is the parasites which spread by sexual route. Tell me the name of the parasites which show vertical transmission. So mark with other pen and write the color coding. So in one classification, you will have a thorough knowledge key which parasites spread by this, which parasite. So you will get all mnemonics at one page. And in the later at below on the page, the space remaining, you can write the mnemonics also. I am give you 50 mnemonics now. Let me start mnemonics. If the classification is complete now, understanding mnemonics is very easy. Should I start mnemonic? Okay. Before starting mnemonic, the largest and smallest, इसमें बहुत MCQ आते हैं. So okay, I told you we divide parasitology into 2 categories, right? Protozoa and metazoa. You know it. Now tell me largest protozoa. Tell me smallest protozoa. In the metazoa, there are 3 categories: cystode, nematodes, and trematodes. Okay, in each category, tell me the largest one, smallest one, largest one, smallest one, largest one, smallest one. So overall largest and smallest. Overall largest and smallest. You got my point. So what questions I want from you? No, it is very confusing. That's why I've written like this. So in protozoa, let's finish one by one. Protozoa में largest और smallest बता के खत्म करो. First tell me largest and smallest in the protozoa. Then we will come on metazoa. In the metazoa, in each category we will finish, and then overall I will tell you कि इनमें से कौन है. Give me a thumbs up. Give me a thumbs up. Everyone give me a thumbs up. तो largest smallest पे बहुत question आते हैं. Now you know the classification. It will be easy for you. Let me start with protozoa. Protozoa में only largest is there, smallest is not there. So the largest one. What is the largest one? I taught you. The largest protozoa is the Balantidium coli. You can learn like this: B for bada. B for bada. It is the largest. You know, Hindi mein bada is largest. So Balantidium coli. Balantidium coli is the largest protozoa. Smallest protozoa is, we cannot say, we cannot comment. So smallest ko rehne do. Among the protozoa, the largest is Balantidium coli. Now let me start the 3 categories one by one. So I am starting parasitology, protozoa, and metazoa. In the protozoa, the largest one is Balantidium coli. Smallest, no one is smallest. So I cannot comment on that. So there will be no question on smallest. Yeah, but largest one asked multiple times. Metazoa in each category I will tell you separately. Let me start with cystodes. then I will come on trematode, then I will come on nematode. One by one, I will tell you, right? So let me start with cystode. Let me start with cystode. Cystode में largest है Taenia saginata. It is not Taenia solium. There are two Taenia ना, solium and saginata. Solium और saginata की spelling लिखो. Write down the spelling of solium and saginata. So of course saginata is bigger than solium. So saginata is the largest one. Now you will never forget. So saginata or smallest one is echinana. 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 Nana का मतलब होता है dwarf. In Greek language, the word nana is small. And nana you can learn like Hindi mein nanha munna bachcha. So nanha is small, right? In Hindi. So you can learn like that. So Taenia saginata and echinana. We are done with cystodes. Let me come on nematodes now. Nematodes में largest and smallest बताओ. Nematodes में largest you can learn this one, Trachanculosis madiniensis, which is a tissue one. ये tissue में था, ये intestine वाला है और I guess ये tissue वाला है. यहाँ पे ये tissue वाला है और ये भी tissue वाला है. The smallest one is Trichinella spiralis. So both of them tissue में मैंने दो ही बताए थे. This is the largest and smallest in the nematode. Give me a thumbs up. Give me a thumbs up. Let me come on trematodes. Trematodes में largest is Fasciola busci. Busci was intestinal. It is not Fasciola hepatica. It is Fasciola busci. Busci का B for बड़ा. B for बड़ा. Smallest कोई नहीं है यहाँ पे. Right? तो ये तीनों कैटेगरी में हो गया. अब overall बताओ. Overall हेल्मेट में largest कौन है? तो largest बताओ. There are three largest ना. Among the cystode, it is Taenia saginata. Among the nematodes, it is Dracunculosis. And among the trematodes, it is Fasciola busci. So in तीनों में से largest overall is Taenia saginata, which is a cystode. Give me a thumbs up. Okay, I'm trying to simplify it. So it's difficult for me also, but I will try hard. Okay, parasites. Parasites divided into two categories: the Protozoa, okay, and the Metazoa. Right? We divide the Protozoa into 5 categories: the amoebas, the flagellates, the sporozoans, the ciliates, and the microsporidia. There are many parasites inside them. I'm not enumerating all. Okay, Metazoa we divide into 3 categories: the cystodes one, the trematodes one, and the nematodes one. Everyone give me a thumbs up. You know that. You know that. Okay. Tell me among the protozoa, not in each category, overall largest one in the protozoa, not in individual category. What is the answer? Who will tell me the answer? Lavanya, Payal, who will tell me the answer? Subhash, would you like to tell me the answer? Protozoa में answer क्या है? It is one of the ciliate. The answer is Balantidium coli. So Balantidium coli is the largest protozoa. Smallest का सवाल नहीं है. This one is the largest. पहले largest complete करते हैं, फिर smallest पे आएंगे. Give me a thumbs up. You got my point? Give me a thumbs up. So what is the largest protozoa? Answer is Balantidium coli. Largest protozoa. Come on, Metazoa. In each category, first tell me. Among cystodes, the answer is Taenia saginata. Right? Among trematodes, the answer is Fasciola busci. And among nematodes, the answer is Dracunculosis mediensis. So that is the largest. Right? ये तीनों कैटेगरी में अलग अलग है. That's why overall कौन largest है? Overall is Taenia saginata only. So Taenia saginata. So largest का chapter खत्म. So see the questions on the largest. How many questions you will get largest? So question can be, what is the largest protozoa? Answer is Balantidium coli. What is the largest cystode? Answer is Taenia saginata. What is the largest trematode? Answer is Fasciola busci. What is the largest nematode? Answer is Dracunculosis madeiensis. What is the largest overall metazoa or helminth? Answer is Taenia saginata, which is a cystode. So these are 1, 2, 3, 4, 5. 5 questions on the largest. Everyone give me a thumbs up. Everyone. I cannot super simplify than this. Give me a thumbs up. Appreciate my efforts. Let me finish the chapter of smallest now. Smallest पे आ जाते हैं. Smallest की कहानी बताओ. Who will tell me the story of smallest? Protozoa में there is no smallest. So leave it. Come on the smallest in the metazoa. Metazoa में smallest पे आते हैं. Metazoa में smallest में okay, what is the smallest in the cystode? I forgot. Can anyone help me? Cystode में smallest one क्या था? What was the smallest? Let me think the classification. Okay, it is H nana. I remembered. It is H nana. H nana is the smallest among the cystodes, right? Cystodes में smallest is H nana. Nematodes में smallest कौन था? It is Trichinella spiralis. It is the smallest among nematodes. Trematodes में smallest is not documented, right? And overall, if you ask me, it is H nana. It is H nana. Everyone give me a thumbs up. Everyone. तो smallest पे 3 ही क्वेश्चन आएंगे. Either smallest cystode or smallest nematode or smallest overall metazoa. So you will get 3 questions here. Everyone give me a thumbs up. Yes, Sunil, Payal, very good, very good. So ये largest smallest का चक्कर अगर खत्म हो गया तो let me move ahead. Give me a thumbs up फटाफट. Everyone got the largest and smallest. So largest में 5 questions you will get. Can you tell me the answers of all 5? You tell me largest protozoa. Now understand the question properly. you will get all the options, the similar options, सारे largest वाले ABCD option होंगे. You will get confused. I'm asking largest protozoa. I'm asking largest cystode, largest trematode, largest nematode, and overall largest metazoa. You got my question? So who will tell me the 5 answers? 1, 2, 3, 4, 5. Let me ask smallest के भी. Then सारे answers हम साथ में देखेंगे. Smallest में protozoa में smallest documented नहीं है. You tell me smallest cystode and you tell me smallest nematode and overall smallest metazoa. Only 3 questions in the smallest. Who will tell me the answer? Can any one of you will try? Okay, some students are trying. So these you can see 5 plus 3, 8 MCQs are in front of you. The confusing one, the one who can solve these, those who have a thorough knowledge of the classification, only those can solve. Otherwise the others will get confused. Right? So sometimes you will say कि मैम आप तो आंसर बोल देते हो कि यहाँ पे पैलेंटिडियम कोलाई है, यहाँ पे आंसर टीनिया सेजिनाटा है, तो ओवरऑल लार्जेस्ट है कौन? You read the question properly. If I ask largest protozoa, the answer is Balantridium coli. You all are right. Largest cystode, it is Taenia saginata. Largest trematode, let me think. Trematode का classification क्या था? It is Spatula busky. B for बड़ा. Right? यहाँ पे भी B for बड़ा, यहाँ पे भी B for बड़ा. Right? Largest nematode, it is Dracunculosis medinensis. Learn like that कि in our plus sign of the medical, the worm, this is the largest nematode which is sitting here. It is Dracunculosis medinensis. You will never forget now. Give me a thumbs up. Overall largest metazoa. Tell me among these who is the overall largest? ये तीनों largest हैं. Largest cystode, largest trematode, largest nematode. But overall is cystode only. Taenia saginata. So see the 5 answers are in front of you. Very good, Payal, Lavanya, Samir, Jayant. Very good, very good. All the students who are participating, I appreciate your efforts. Very good. Tell me the smallest. Smallest के answer जरा बताइए. Tell me the smallest cystode. What is the smallest cystode? It is H. nana. H. nana. Smallest nematode, Trachinella spiralis. And tell me overall metazoa. It is H. nana only. Now see how beautifully the examiner can give you questions on largest, smallest. Everyone give me a thumbs up and write all these on one paper, on one page, on one point. You are not getting notes on YouTube. So you have to make your own notes. Give me a thumbs up. Still, if you want me to share my PDF with you, I can share. Tag me on the Telegram. I will share the PDF with you. Definitely the same PDF I will share with you. Tag me on the Telegram. Everyone give me a thumbs up first. Should I proceed ahead? Shall I proceed ahead? I should. So the smallest largest ka chakkar khatam hua, so we will move on some other mnemonics. Till now we have done 2 things. We have understood the complete classification of entire parasitology, and among that classification who is the largest and who is the smallest in each category, and overall also we have done that also. Give me a big thumbs up. Okay. After that we should move on the next. So we have seen the largest, the smallest. Okay. ये सब हो गया largest, smallest के बाद आगे बढ़ते हैं. Okay, yeah. Okay, one more thing. Just a second. Give me a minute. Yes. So, okay. In fact, stage nahi. Start the mnemonics now. Start the mnemonics. Tell me the name of the parasites which show antigenic variation. Tell me the name of the parasite which show antigenic variation. You know what is antigenic variation? Like COVID virus nowadays, that is the best example I can comment here. COVID virus is showing antigenic variation. No? It is changing its antigen every few days, every few months. So we are preparing vaccine against the one variant, but after few days the virus is changing its antigen and new variant is coming. So it also occurs in few parasites, not all. So ये धोखेबाज होते हैं, ये अपना चेहरा बदलते रहते हैं. So there are 3 parasites which show antigenic variation. Tell me the name of 3 parasites. Now, 3 parasites is Giardia. Now you have to tell me the category of each of them. तुमने classification पढ़ा है ना? You have read the classification. Tell me the category. Giardia, Trypanosoma, and Plasmodium. The mnemonic is GTP. You know GTP. GTP is the mnemonic. So what is G? G is Giardia. Giardia. G से एक ही parasite है. पूरी parasite में. You will not have confusion in G. P से there are 2. I guess Plasmodium and Paragnomius pester mani भी है. But yeah, it is Plasmodium. But T से many T हैं. It is Trypanosoma. It is not Toxoplasma. It is Trypanosoma, not Toxoplasma. T कितने हैं? Total how many T's you know? Toxoplasma, Trypanosoma, Trichomoniasis, Trichinella spiralis, Trichinella. I am remembering 5. There may be more. So T बहुत सारे हैं. You will get confused in the T. So this T is Trypanosome. पहले ये बताओ ये तीनों Protozoa हैं कि Metazoa हैं? All these parasites are Protozoa or Metazoa. You have learned the classification. Na? Sameer, Lavanya, Payal, Sakshi. What are these? What are these? These all are Protozoa, right? None of them is Metazoa. I guess. Yes, I am right. I guess. Giardia is a I guess it is a flagellate. It is a flagellate, right? It is an intestinal flagellate. Trypanosoma, it is hemoflagellate, and Plasmodium, it is sporozoans, right? This is the classification in the category. You may be remembering these all are protozoa. Protozoa की categories हैं. ये intestinal, ये hemo. Give me a thumbs up. Am I right? So okay, now in your classification, if you have drawn the classification on one page, mark these three. You will get your answer. Mark these three where they are lying. See, all of them are protozoa. So the mnemonic is GTP. So the parasites, give me a minute. Or let me see my, okay, I'm not having my pen here. I guess pen to hai, but give me only 1 minute because I want to revise all of these in the end now. So let me write here. So the parasite showing antigenic variation is done. Let me move to the next mnemonic. The mnemonic is GTP. Let me move on the next mnemonic. This is the next mnemonic in front of you. The parasite which enter human body by penetrating the skin. They penetrate the skin. So whenever a person walks barefoot, without slippers, without shoes, on soil, on sand, on seashore. So this is the soil. So the parasites present in the soil, many parasites are present in the soil. You may be knowing that. These are the parasites. So they enter directly by penetrating the skin, and they will enter the lymphatics and blood here. So I will teach you in the parasitology. If you have attended my past lecture, you may be knowing that. So these are the parasites which enter human skin by penetrating skin when a person walks barefoot, without shoes and slippers, on sand, on soil. So parasites in infective stage, they can penetrate. So how many? So some of them can enter the human skin if the abrasion is there, if a cut or abrasion is there. Some of them even can enter the intact skin. If there is no cut, no abrasion, even they can enter. So there are 5 parasites. The mnemonic is Hans, Hanss. The mnemonic is Hans. So what is the full form of Hans? Let's see. H for H nana. You know where is H nana. A for Ankylostoma duodenale. You know where is Ankylostoma duodenale, right? N is Necator americans. S, one S is Cystosoma and one S is Strongyloids. All of them are Metazoa. None of them is Protozoa. They are Metazoa. Metazoa mein you have to see the categories. Some of them are nematodes, some of them are cystodes, I guess. Trematode koi bhi nahi hai, right? I guess these all are nematodes, and this one, I guess this is a cystode. And you know the category. If you know the classification, it's easy for you to look out from which category these parasites belong. Everyone give me a thumbs up. Everyone. So the mnemonic is Hans. Say the full form of Hans again and again. Okay, you want me to more slow. I'm already slow. I will try to do more. Okay. So the mnemonic is Hans. So till now I taught you 2 mnemonic. The first mnemonic, इससे पहले largest smallest का चक्कर हो गया. Right. So the first mnemonic, the parasites which show antigenic variation, the mnemonic here is GTP. The second I am teaching you the parasites which enter human via penetrating skin. The mnemonic is HANSS. Say the full form. यहाँ पे सारे के सारे protozoa थे. All of them were protozoa. यहाँ पे all of them are metazoa. Give me a thumbs up. Everyone give me a thumbs up. If you know the thorough classification, now see it's very easy for you. Coming on the third mnemonic. The third mnemonic ये तो skin से enter हो रहे हैं. The parasite which are entering via penetrating the human skin. Tell me the name of the parasites which enter by sexual contact. By sexual intercourse, they enter from one human being to another human being. So this is a human being. He is having or she is having some infection. So when this person do sexual contact, sexual intercourse with another person, then they can transmit the infection, few parasites from this to this. Tell me the name of those parasites. What is the mnemonic? The mnemonic is get, G-E-T, get. You can learn like that, get it sexually. So G-E-T, the 3 mnemonics are G-E-T. 3 parasites. Let me tell you the full form of GET. The G is Giardia lamblia, which is a protozoa. You know, it is a flagellate. It is an intestinal flagellate. G. E is Amoeba histolytica, the only amoeba which causes disease, the pathogenic amoeba, right? So this is amoeba, this is flagellates, and what is T? Trichomonas vaginalis. It is also a flagellate. It is genital flagellate. This is intestinal, this is genital. Now T देखना, it is trichomonas. The T is trichomonas, right? It is यहाँ पे जो T था, that was trypanosoma. GTP का T trypanosoma था, right? और gated sexually का T trichomonas है. Now the 3 parasites are in front of you. They enter by sexual route. So GET, get is the mnemonic. GET, get is the mnemonic. So till now we have done 3 mnemonics. GTP, antigenic variation. Hans, enter by skin, and get, enter by sexual route. Spread from one person to another by sexual route. Give me a thumbs up. Till now 3 mnemonics are ready. Tell me the name of the parasites which show antigenic variation. Tell me the name of the parasites which enter human by penetrating skin, and tell me the name of the parasites which enter from one human being to another human being via sexual intercourse. Can you tell me the three mnemonics just for revision? Tell me what is the first mnemonic? The first mnemonic here is GTP. Can you tell me the full form of GTP? It is Giardia lamblia. It is Plasmodium. T में मुझे हमेशा confusion होता है. मैं अपना बात बता रही हूँ, मुझे confusion होता है. It is Trypanosome. So let me think. मैं सोच के बोलूंगी. एकदम से I will not jump कि this is the T. Yes, it is Trypanosome. Yes, it is. Yeah, it is Trypanosome. Yes, I'm right. It is Trypanosome. So coming on the parasites which enter via penetrating skin, the mnemonic is Hans. HANSS. So tell me what is HANSS? H is H nana. It is a cystode, smallest cystode, right? A is Ankylostoma duodenale and Necator americans, right? The two S, one is cystosomiasis. What was other S? एक और S है ना, strongyloids. So all of them are nematodes, and this one is cystode. So these are the 5 parasites. Sexual, by sexual route, there are 3. The mnemonic is GET, get it sexually, GET. So again, G is Giardia. G to Giardia hai. E is Entamoeba histolytica, the only amoeba. It is not Antropius vermicularis. It is Entamoeba histolytica. What is tree? It is Trichomonas vaginalis. You can learn like vagina. Vaginalis sexually. So if the parasite is present in the vagina of the female can transmit the infection to the sexual partner, right? So vagina se yaad aayega Trichomonas vaginalis. Give me a thumbs up, a big thumbs up, a big thumbs up. Till now only 3 are done. The count is more than 50. So you just make the columns and write down. Write down full form also. Don't write only mnemonic. Write down G kya hai, T kya hai, P kya hai. Write down the full form also. It will be helpful for you, right? Moving to the next mnemonic, the fourth mnemonic. The fourth mnemonic is in front of you. Now, till now, I taught you the mnemonic which enter by skin, the mnemonic which enter by sexual route. Now, I'm teaching you the parasites which enter from mother to fetus via placenta. That is known as vertical route. This is known as vertical route. You got my point? So, vertical or congenital. The parasites, okay. There's a pregnant lady. Let me draw a diagram of a uterus of a pregnant lady. The lady is pregnant. So if the lady is pregnant, this is the fetus inside the lady, inside the uterus of the lady, this is the fetus. This is the growing fetus. Can you appreciate the placenta? This is the placenta. If the mother is having some parasites can cross the placenta and causes the infection in the fetus also. So this route from mother to fetus via placenta. So infections are transmitting from mother to fetus via placenta. This route is known as vertical route. Vertical route or transplacental route. So congenitally, this fetus will have certain parasitic infections. So tell me those. Tell me the name of those. So there is a mnemonic. Mnemonic is parents to teacher meeting, right? Parents, isse yaad aayega mother. It is transmitting from mother to fetus now. So PTM, you know PTM hota hai na, parents to teacher, PTTM, parents to teacher meeting. So PTTM is the mnemonic. PTTM. Now there are 2 T, right? So let me tell you the full form of PTTM, right? So P is for Plasmodium, very easy. And M is for Microsporidia. Where is Microsporidia? The 5th category in the Protozoa. Protozoa में 5 categories थी ना? The last one is the Microsporidia. It is having only one parasite, Microsporidia itself, right? So Microsporidia, Plasmodium is also a protozoa from the sporozoans category. The 2 T are Toxoplasma gondii, Plasmodium का ही बड़ा भाई है Toxoplasma, and Trypanosoma cruzi. Trypanosoma cruzi is a flagellate. You can know the categories now. So this one is a sporozoan, this one is a sporozoan, this one is a flagellate, and this one is Microsporidia itself. And all of them are protozoa. All of them are protozoa. None of them is metazoa, I guess. If I'm wrong, please correct me. I'm also a human like you. I'm not having supernatural powers, so I can also do mistakes. So if I'm doing any mistakes, please correct me. Please correct me. So I'm trying hard. So the mnemonic is PTTM. Say the full form. Everyone give me a thumbs up. Everyone give me a thumbs up. So these are the parasites which spread by vertical route. The mnemonic is PTTM. It is Plasmodium, Microsporidia. The 2 T are in front of you. Toxoplasma and Trypanosoma. Give me a thumbs up. Toxoplasma and Trypanosoma. Give me a thumbs up. You are not giving the thumbs up. Thumbs up do pehle. Should I proceed ahead to the next mnemonic, the 5th mnemonic? So the 5th mnemonic is in front of you. The 5th mnemonic in front of you. Tell me the name of the parasites which resides in muscles. Any muscle will work. It can be skeletal muscle, it can be smooth muscle, or it can be cardiac muscle. There are 3 muscles in human beings, I guess. There are 3 muscles. So muscles. The parasites which resides in muscles. Okay. First, I will tell you the name of the 5 parasites which resides in muscle. The 5 parasites which resides in muscle is T4E. The mnemonic is T4E. तो टी में पहले ही कंफ्यूजन कम था और टी आ गए, देयर आर 4 टी नाउ। टी में भारी कंफ्यूजन रहेगा। I'm warning you, you will always get confusion in the mnemonics in T. There are multiple T in parasites. There are 4 T. The 2 T are Taenia. Okay, the 2 of them are Taenia. So Taenia saginata, Taenia solium. They reside in muscle. Which muscle? Saginata remain in cow or buffalo muscle, and solium remain in pig muscle or human muscle, right? Solium. So solium, you know, solium is pig pork tapeworm, and saginata is it is cow tapeworm or buffalo tapeworm, right? So that is known as bovine tapeworm, right? So saginata remain in the muscle of cow or buffalo, that is bovine muscle, and solium remain in pork muscle. So if someone is eating the meat of cow without cooking, uncooked meat, so the person, human, can have infection of Taenia saginata. That is the root of infection in Taenia saginata. If someone is eating meat of pig without proper cooking, uncooked or undercooked, I am saying uncooked. Uncooked to hardly koi khata hoga, undercooked you can say, not cooking properly. So the parasite is present. So in the meat, people used to eat the muscle of these animals. So in the muscle, the parasite is present. Parasite का क्या present है? Parasite का larva present है. The larva of the parasite is present in the muscle of these animals. So name of larva is in front of you if you want to do more detail. Taenia saginata के larva का नाम है Cysticercus bovis, और Taenia solium के larva, the name of the larva is Cysticercus cellulose. You can't imagine इस पे कितने क्वेश्चन आते हैं. This combo is deadly important. This combo is deadly important. Multiple MCQs come from this two lines. So 2T तो हो गए. Out of the 4 we are done with 2T. The 2 Taenias, Taenia solium, saginata. So out of the 4T we are done with 2T. That another 2T. The third T is Trichinella spiralis. It occurs in pig, rat, human. किसी में भी हो सकता है. And again the larva, right? Usually it occurs in this thing, heart muscle. So it causes myocarditis. So in the heart muscle it remains, right? Then coming on the 4T. The 4T is the toxoplasma. Toxoplasma again remain in the human ke heart muscle. And again a cyst or pseudocyst will remain. Give me a thumbs up. The last is Echinococcus granulosus. Again it remains in the muscle and it causes hydrated cyst. Give me a thumbs up. So E for Echinococcus granulosus. The 4T are in front of you. The 2 are Taenia. One is toxoplasma. The 2 Taenia are cystodes. I guess you know. Trichinella spiralis is a nematode. So these are Metazoa, and Toxoplasma is a Protozoa. It is a sporozoan from the Protozoa. So you know the classification. It's easy to pick up कि parasite कहाँ पर है. पहले classification याद करो. If you don't know the classification, these things are wastage for you. Learn classification thoroughly. Maximum MCQs will be created from classification only. Classification is the key. You should learn the classification. And last E is Echinococcus granulosus. Give me a thumbs up. So tell me the name of the parasites which resides in muscle. How many parasites you know? So T, 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 E. T4E is the mnemonic. Let me write this also. Muscle में हो गया T4E. What's the full form? The two are Taenia solium, Taenia saginata. This one is solium. This one is saginata. Okay, next is toxoplasma. And next is Trichinella spiralis. Right. E is, what was E? Echinococcus granulosus. Now, among which, what other questions can be asked? This one occurs, the solium one occurs in bovine, that is cow, buffalo. Saginata, no, I'm wrong. Solium occurs in pig, pork. Saginata occurs in bovine, that is cow, buffalo. Toxoplasma, Taenia, Trichinella spiralis, and Echinococcus granulosus. It can occur in human. The muscle. Which muscle? This one occurs in skeletal muscle. This one occurs in skeletal muscle. This toxoplasma will remain in cardiac muscle. Trichinella spiralis again cardiac muscle. This again skeletal muscle. Right. Now which form? So here larva. I guess here larva. Here also pseudocyst. And here cyst. So learn where is larva, where is cyst, where is pseudocyst. So ये सारे MCQs can come in your exam. Everyone give me a thumbs up. So simple MCQs will be there, but you should know the mnemonics. Mnemonics will make your MCQs super easy. Coming on the next mnemonic. So you know acid fast staining is there. There is a stain which is known as acid fast stain, also known as Zeal-Nelson stain. What is acid fast stain? Acid fast stain, also known as Zeal-Nelson stain. You may have heard of it. It is a stain which we do on certain organisms. So some of the organisms are acid fast and some of the organisms are non-acid fast, right? In the list of the acid fast organism, is there is any parasite? I know the bacteria are there. The most important bacteria is Mycobacterium, you may be knowing Mycobacterium tuberculosis, Mycobacterium leprae, it is Legionella, Nocardia, Actinomycetes. These all are acid fast bacteria. I'm not interested in bacteriology today. Yesterday I taught you bacteriology. Today I'm interested in parasites. Tell me the name of the parasites who are acid fast. Can you tell me the name of some parasites which are acid fast? Okay. So sporas are acid fast. How many sporas you know? All sporas are acid fast. Okay, it's a good mnemonic. It is microspora, cyclospora, isospora, cryptospora. Micro. So all sporas. Sporas. Microspora, cyclospora, cryptospora, isospora. Everyone give me a thumbs up. So sporas. Basically the mnemonic is sporas. तो स्पोरास है यहाँ पे स्पोरास में माइक्रो आइसो क्रिप्टो एंड साइक्लो गिव मी अ थम्स अप शुड आई प्रोसीड अहेड आई शुड so overall sare if you want to know ma'am tell me the name of all acid fast organisms including bacteria also parasites also so this is the complete list if you want to know the complete list of acid fast organisms these organisms include bacteria also and parasite also and fungus also everything so the complete list if you want to know uske liye bhi mere paas ek mnemonic hai what is the mnemonic? The mnemonic is no longer separate booking for RIM SIM card. Yesterday also I taught you this mnemonic if you have attended my yesterday's lecture. No stands for nocardia. Nocardia is a bacteria. Longer stands for Legionella. Legionella is also a bacteria. Separate stands for smegma. Smegma bacilli, it is also a bacteria. Booking B stands for bacterial spores. Bacterial spores, of course, bacteria. RIM. So rhodococcus is a fungus. I guess rhodococcus is a fungus. Isospora, यहीं पे और सारे स्पोरा भी ऐड कर लो. Isospora, cryptospora, cyclospora and microspora. So all sporas together, these are the parasites. These are the parasites. Again, R हो गया, I हो गया, M. M is mycobacterium. It is also a bacteria. और सिम इज स्पर्म ह्यूमन स्पर्म मेल में स्पर्म्स होते हैं ना फीमेल्स में ओवा होते हैं so in the male sperms they are also acid fast it is not a bacteria virus or fungus it is human sperm and card का जो C है it is cryptococcus it is a fungus so you can see some of them are bacteria some of them are fungus and some of them are parasites which are acid fast positive you should know the complete list and if you are interested only in parasites so these are the sporas the four sporas give me a big thumbs up I'm trying hard so what is my summary is in front of you tell me the name of acid fast organisms total organisms all organisms which are acid fast so the mnemonic please listen carefully everyone listen carefully no longer separate booking no longer separate booking rim rim sim card no longer separate booking rim sim card say it again and again now tell me the full form so the full form nocardia it is a bacteria legionella it is a bacteria smegma bacilli it is a bacteria bacterial spores of course it is a bacteria right now rhodococcus it is a fungus and cryptococcus it is a fungus so both the fungus are coccus the two coccus are the fungus rhodococcus cryptococcus give me a thumbs up so these both are fungus right okay this mycobacterium is also a bacteria तो अब बचा कौन who is left the left is I stands for isospora it is a parasite but not only isospora से सारे स्पोरास याद आने चाहिए so it is isospora microspora cryptospora and cyclospora all sporas and all coccus the two coccus and the four sporas the two coccus are the two fungus and the four sporas are the four parasites इसके अलावा sperm is neither a bacteria nor a virus nor a fungus I guess give me a thumbs up so these all are acid fast organism in the world give me a thumbs up currently if you want only study parasitology confined on parasitology so these are the four parasites which are acid fast positive let me see I have noted down yes I have noted it down so overall acid fast bhi ho gaya theek hai coming on the next mnemonic the next mnemonic is in front of you tell me the name of the parasites which causes malabsorption in human being so because of the malabsorption in human beings so absorption takes place in the intestine this is stomach this is small intestine so these parasites remain in the small intestine and interfere with the absorption of the food in the small intestine so they cause malabsorption syndromes tell me the name of the parasites so there is a mnemonic what is the mnemonic strong Gia cry for Philip Gia is a girl learn like that Gia is a girl she is very strong but she is crying for Philip so there are four parasites strong से याद आएगा strongyloids Gia से याद आएगा giardia strong Gia क्राई से याद आएगा क्रिप्टोस्पोरिडिया, राइट, एंड फिलिप से याद आएगा इट्स अ रेयर पैरासाइट, मैंने क्लासिफिकेशन में नहीं बताया पर ये कहीं तो है, तो इट इज फिलिप से फिलिपींस, इट इज कैपिलेरिया फिलिपींस, you know strongyloids, it is a nematode, giardia, it is a protozoa, protozoa mein it is flagellate, yes, cryptosporidia, the sporas, it is also a protozoa, protozoa mein sporozoans, give me a thumbs up, and I don't know, you have to check for it, ye kahan pe aata hai classification mein, I will not bluff, mujhe nahi pata. So strong GI cry for Philip, so these are the parasites causing malabsorption, let me write strong GI cry for Philip, give me a thumbs up. Capillaria philippines, give me a thumbs up. So coming on the next mnemonic, tell me the name of parasites who causes anemia in human. So they resides in RBC, they cause destruction of the RBC and they causes anemia. Give me a thumbs up. Either they reside in RBC and causes destruction of RBC, so causes hemolytic anemia, or they go in the intestine. The second way of anemia kya hoga? Either these parasites are remaining in the intestine, this is the intestine, so this is a parasite in the intestine, so they will cause ulcer, holes, ulcer in the intestine, so blood will come in the stool, so patient will bleed from the stool, so less blood means anemia, less RBCs, less blood, all of them are lost in stool, that's why patient is having anemia. This is the first way how parasites are causing anemia. The second way, in the blood vessel, these are the RBCs, these are the RBCs, so the parasite will enter inside the RBC and causes rupture of the RBC. So this is known as hemolytic anemia, and this anemia will be iron deficiency anemia. So two types of anemia can be caused by parasites. Some parasites cause iron deficiency anemia by causing blood loss in the stool. So blood is lost in the stool, patient will have iron deficiency anemia. Patient will have melena, that's blood in stool, right? Some parasite will enter the RBC, causes rupture of the RBC, causing hemolytic anemia. So iron deficiency anemia कौन-कौन से कराते हैं, hemolytic कौन-कौन से कराते हैं? You tell me separately. All the parasites which causes anemia. Give me a thumbs up. First learn the list. I don't have mnemonic. We will together try to make a mnemonic. So many of the students are attending it live. If anything is clicking in anyone's mind, please tell me the mnemonic. So the first is ankylostoma and necator. ये दोनों साथ में आते हैं. Both are, you know, भाई भाई हैं. So ये दोनों हमेशा साथ में आएंगे जहां भी आएंगे. Ankylostoma duodenale and necator americans. These two are them which causes microcytic iron deficiency anemia. The next is diphyllotum latum. Diphyllotum latum. It is a cystode, right? So it is a cystode, diphyllotum latum. It causes megaloblastic anemia, right? The next is the again दो brother, Plasmodium और Babesia. ये दोनों साथ में आते हैं. Plasmodium and Babesia always come together. The next is Leishmania, Leishmania donovani and Trichura trichuris. Do you have any mnemonic? Last time someone told me a mnemonic. Some of my students, I just forgot to note it down. A and D तो चलो end हो गया. PBLT का कुछ बनाओ ना. Punjab. Someone have told me some mnemonic. Punjab Highway. No. Make some mnemonic. Come on. Make some mnemonic of it. Anyone? Hi Dream, Sunil, Payal, Sakshi. Anything clicking to you? See the first letter of all the parasite and make some good mnemonic and share it with everyone. So it will be beneficial for all of you. P, B, L, T and A and D. These are the one letters you are having. Make some mnemonic on it. If something is clicking to you, it's good. Or otherwise, let me think. Okay. 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 Okay, let me make. Do you have some mnemonic? Anyone? I'm giving you time. No. Okay. Okay, let me make it then. P, Punjab. B, Banaras. बीच में लगा देते हैं end. Punjab and Banaras. Long track. So make some mnemonic. No, mnemonics ऐसे ही बनते हैं. Whatever clicking to you, looking at the letters, make some mnemonic. So you can see the full form of looking at the first letters. So if you have some better mnemonic, okay, BALD and TP, good one file. So whatever you want to learn, BALD and TP or Punjab and Banaras के बीच में and लगा दो. Punjab, A and D and Banaras, long track. So learn like this, right? So these all parasites causes anemia. Okay, now let me give you the detail. I'm interested in giving you the detail, right? So among them, these two, ankylostoma and necator duodenale, they cause iron deficiency anemia. That is microcytic anemia. Diphyllotum latum causes megaloblastic anemia because it loves B12. Whatever B12 I am eating. If I am having diphyllotum latum in my intestine, so before B12 get absorbed inside me, D latum will eat all the B12. So the patient will have B12 deficiency. That's why patients have megaloblastic anemia. Plasmodium and Babesia, these both will cause hemolytic anemia. They will cause hemolytic anemia. They cause rupture of the RBC and they cause any anemia. Leishmania and trichuris. I don't have details of them. Which anemia? Everyone give me a thumbs up. Everyone give me a thumbs up. So these are the name of the parasites which causes anemia. अनीमिया, जस्ट फॉरगॉट, लास्ट टाइम एक स्टूडेंट ने बहुत ही अच्छा निमोनिक बताया था. ओके, पंजाब एंड बनारस लॉन्ग ट्रैक. सो दीज आर द नेम ऑफ द पैरासाइट्स व्हिच कॉजेस अनीमिया. इस पे बहुत क्वेश्चन आता है, बहुत क्वेश्चन आता है. प्लीज लर्न, मेक सम निमोनिक and learn it. Everyone give me a thumbs up. Everyone give me a thumbs up. Should I proceed? Should I proceed? The next is in front of you. Auto-infection. Auto-infection is seen in which parasites? Auto-infection means there is always a source of infection now. So this is a human being. If I am saying that this human being is getting a parasitic infection, this human being is getting a parasitic infection inside. So you will ask, ma'am, what is the source? Is it fecal-oral route? So the person is eating or drinking something contaminated with the parasite. Is it sexual route? Right? Is the parasite entering by skin? Is the parasite is entering from mother to fetus by vertical route? Right? So there are various routes you may be knowing. One of the route is auto-infection. Auto-infection. There is no external route. The patient is getting infection from himself or herself. So parasite is present inside the human being, and before coming out, it is reinfecting the human. That is known as auto-infection. So name the parasites. Only 5 parasites in the world show auto-infection. So the mnemonic is chest, CHEST. So auto-infection का mnemonic हो गया chest, CHEST. Chest is the mnemonic. Chest is the mnemonic. What is the mnemonic of auto-infection? Chest is the mnemonic of auto-infection. Give me a thumbs up. What is C? C for capillariasis or cryptosporidia. दो C हैं. H is H nana. E is Antrobius vermicularis. Right? S is strongyloids and T is Taenia solium, not saginata. इस पे बहुत confusion होता है. It is solium, the pig वाला, pig or pork वाला. It is not bovine one, which causes auto-infection. इन पे बहुत question आते हैं. The mnemonic is chest. Give me a thumbs up. Everyone give me a thumbs up. So these are the name of the parasites which show auto-infection. These are the name of the parasites which show auto-infection. You want to revise me till now कितने mnemonics पढ़े हैं? Then there are more than 50 mnemonics. You will tired, but I will not tired giving you more and more and more mnemonics. Let me do a big revision, a small revision, not a big revision. So tell me the name of the parasites which show antigenic variation. Tell me the name of the parasites which enter humans by skin, by penetrating skin. Tell me the name of the parasites which enter human by sexual route. Tell me the name of the parasites which enter human by vertical route. Tell me the name of the parasites which resides in muscles, in the muscles of human or other organism. Tell me the name of the parasites which are acid fast. Not only parasites, tell me all the organisms which are acid fast. All the organisms which are acid fast की दो mnemonic बताना. Only parasites or all organisms? Here you tell me only parasites. Here you tell me all organisms which are acid fast. Not stop here. Tell me the name of the parasites which cause malabsorption. Tell me the name of the parasites which cause anemia. मेरा पेज ही खत्म हो गया. Tell me the name of the parasites which cause auto infection. यहाँ पे शुरू करते हैं. Okay, it will be like this. So tell me, we will continue the series. We will continue the series. Don't worry. It is not an end. It is a beginning. It is the trailer. Complete movie abhi baki hai. Okay, you tell me. Who will help me? Who will help me? Okay, students already started. Very good. Very good. Very good. Okay. So, okay, let me start from here. Okay. So start antigenic variation. Name the parasites which show antigenic variation. What is the mnemonic? The mnemonic is GTP. I'm not saying the full form. If I say the full form, it will be never lasting. So you say the full form by yourself. Tell me the name of the parasites which enter human beings by penetrating skin. What is the name of the parasite? Hans. Hans. Yes, Hans. So very good, Samir have told the full form also. It is Giardia, Trypanosome and Plasmodium. Full form बोलना तुम्हारा काम. Mnemonic I will write. It is an easy job to write the mnemonic, but to say the full form is difficult one. That is your job. You tell me the full form. So it is Giardia, Trypanosome and Plasmodium. Very good, Samir, very good. So the skin one is Hans. So you tell me what is the full form of Hans, or think in your mind. Don't tell me. Just have a thought in your mind. What is the full form? You are knowing the full form. Tell me the name of the parasites which enter sexually. Get it, sexual. GET. 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 What is T here? What is T here? Tell me only T. सेक्सुअल है ना, सो इट इज वजाइनलिस, ट्राइकोमोनास वजाइनलिस. सेक्सुअल से मुझे वजाइनलिस याद आएगा. So I will never forget, it is Trichomonas vaginalis. It is not Toxoplasma. It is not Trypanosoma. It is Trichomonas vaginalis. You got my point? That is sexual route. Tell me the name of the parasites which enter by vertical route. Vertical means mother to fetus. तो मदर से मुझे याद आएगा पेरेंट. मदर इज अ पेरेंट ना, मदर टू फीचर्स है ना, तो पेरेंट टू टीचर मीटिंग, PTTM. PTTM, parents usually go to in PTTM, you know, so all the parents know what is PTTM, right? So they go in their children's school to attend their PTTM. So parents to teacher meeting, right? PTTM, you may be. So what are the two T's here? What are the two T's? One of the T is Toxoplasma, other T is Trypanosoma. राइट, हियर ट्राइकोमोनाज है, यहाँ पे ट्रिपैनोसोमा है, यहाँ पे टॉक्सोप्लाज्मा और ट्रिपैनोसोमा है. कंसंट्रेट ऑन टीज, कंसंट्रेट ऑन टीज. कमिंग ऑन द नेक्स्ट mnemonic, टेल मी द नेम ऑफ द पैरासाइट्स व्हिच रिसाइड्स इन मसल. मसल में कौन कौन है? Who will tell me? मसल के क्या है? Yes, trypanosoma, toxoplasma, Sameer. Very good. मसल में कितने हैं? No one have. Okay, Sakshi already taught the mnemonic. It is T4. Yes, Payal. T4. 1, 2, 3, 4. T4E. So what is the full form? चारों T बताओ. Sakshi, Payal. What are T? So it is Taenia solium and Taenia saginata. दो तो ये हो गए. One is toxoplasma. What is the fourth one? Fourth one is Trichinella spiralis. Trichinella spiralis. Give me a thumbs up. What is E? E, you may be knowing. I guess this E is Antropius vermicularis है कि Entamoeba histolytica है? Just check it. What is this E? So you give me a thumbs up. These are the parasites which resides in muscle. After muscle, tell me the name of the parasites. Yes, it is the Echinococcus granulosus. Yes, very good. Very good, Sameer. The Taenia, Toxo and Trichinella. Very good. Tell me the name of the parasites now. Tell me the name of the parasites which are acid fast. Which are acid fast. So sporas. Learn sporas. Sporas. How many sporas you know? So 4 sporas. Microspora, isospora, cryptospora, cyclospora. MICC. So 4 sporas are there. You got my point? Tell me the name of all organisms which are acid fast. Not only parasites. Tell me the name of all organisms. What is the mnemonic? No longer separate booking for RIM. RIM, RIM, SIM card. इसमें जो I है, this I am not saying the full form again, this I is a parasite. ये है आपका आइसोस्पोरा, और आइसोस्पोरा से आपको बचे हुए सारे याद आने चाहिए, that I am assuming. So with आइसोस्पोरा you should remember all sporas here, right? Others are bacteria and fungus. Give me a thumbs up. Give me a thumbs up. So that is acid fast organisms. Coming on the parasites which resides in which causes malnutrition. What is the mnemonic? Malnutrition कौन कराएगा? Who? Tell me the name of the parasites which causes malnutrition in humans. Who will tell me the mnemonic? Strong Gia. Strong Gia. Gia is a girl. She is very strong, but she is crying for Philip. So strong Gia cry for Philip. So tell me the full form. 4 parasites are there. Strongyloids. Strong for strongyloids. G for Giardia. Gia. Cryptococcus. Cry for Cryptococcus. And it is Capillaris philippians. Capillaris philippians is the parasite. Is a rare parasite. Okay, not very important. Coming on the name of the parasites which causes anemia. Tell me the name of, यहाँ ले लेते हैं anemia, वहाँ बहुत corner में हो गया ना. So tell me the name of the parasites which causes anemia. Okay, someone of you, I forgot the name, told me one more mnemonic. I read it. So what is the mnemonic? Someone of you told me what was Punjab and Bangalore league. What was that league? No. So cricket league. Which league you told me? So league team. Punjab and Bangalore league team. You can learn like this, or Punjab and Bangalore long track league team, whatever you say. Yes. So P and B L T. Yes, this is the mnemonic. So you can learn like Punjab and Bangalore league team. Learn like that, right? P for Plasmodium, B for Babesia. ये दोनों तो हो गए. What is A and D? A और N तो भाई भाई है. That is Ankylostoma duodenale, Necator duodenale, or Necator americans. D is Diphyllotum latum. Diphyllotum latum. This is Leishmania. This is Toxoplasma. Everyone give me a thumbs up. Everyone give me a thumbs up. These are the name of the parasites which causes anemia. You may be knowing that which anemia. You may be knowing which anemia. Yes, Punjab and Banaras long track, Punjab and Bangalore league team. Whatever you learn one mnemonic. Don't learn multiple, you will get confused. So learn one of the mnemonic. Tell me the name of the parasites which causes autoinfection. The last. Tell me the name of the parasites which causes autoinfection. Who will tell me the name of the parasites which causes autoinfection? What was the mnemonic? The mnemonic is chest. भूल गए क्या सब लोग? The mnemonic is chest. You may be knowing the full form of chest. Very, very. What is T in this chest? Tell me only T. Don't tell me others. I know you know others. Tell me only T. What is T here? Payal, what is T? Sameer, high dreams. What is T? T is Taenia solium की saginata. चलो मैंने clue दे दिया. Yes, Sameer. It is solium. It is not saginata. The solium one, the pig one, the pork one causes autoinfection. The bovine one do not cause autoinfection. So very important. In your options, you will get both Taenia solium and saginata. Examiner will definitely confuse you. Now you yourself give a thought that these mnemonics I have already taught you. You yourself give a thought that these more, as many as more I am going to give you ahead. So if you compile all these mnemonics and learn the full form and revise all the mnemonics, it will take hardly half an hour or 1 hour. Before entering in the exam hall, give 1 hour or half hour to revise all the mnemonics from the parasitology. I can guarantee whatever question in parasitology, the big clinical one or one liner, coming in your exam, you will be able to crack. These mnemonics are super useful for you in your exam. And yes, of course, after the exam, you will bless me that, ma'am, you have given so beautiful mnemonics, and these are very, very useful. Many students have given me this feedback after appearing in the exam, that these mnemonics are very useful and easy to remember. And in the exam, these are like weapons. Like, we just take the mnemonic and the answer is in front of us. So there is no confusion at all. So please take these mnemonics on priority, write down, note them, and revise them before going to your exam. You want me to move ahead? You want me to move ahead? Say yes or no. So Samir, my Telegram group. Samir, I'm available on Unacademy Telegram. On Unacademy Telegram group, the name of the Telegram group is Let's Crack NEET PG. It is a Telegram group of Unacademy. Let's Crack NEET PG. First, join this Telegram group. After joining this Telegram group, go in the members of the group. In the members in the group, you search me by this name, Medlife. Capital M, capital L. Medlife by Dr. Priyanka. By Dr. Priyanka. Search me by this name. This is my Telegram ID. I'm available in the members. Tag me so I can guide you further. So tag me there and ask your doubt there. Okay. Can I proceed ahead? Okay. Coming on the next mnemonic. Coming on the next mnemonic. The next mnemonic, the mnemonic which I'm going to give the next is in front of you. Tell me the name of the parasites which reside in blood. That is hemoparasite. Hemo means blood. Tell me the name of the parasites which reside in blood. Tell me the list of the parasite. Protozoa में से कितने हैं, nematodes में से कितने हैं, metazoa में से कितने हैं. How many protozoa, how many metazoa? Right. Tell me the name of the blood parasite. Blood parasite. Right. Tell me the name of the parasite which reside in urine, which are known as uroparasite. Urine. And tell me the name of the parasite which resides in brain, neuroparasite. You can't imagine इसमें से कितने questions आते हैं. So make some mnemonic. I'm not having it ready made for you, but we will try together. So hemoparasite, uroparasite, neuroparasite. Let me first finish hemoparasite. Hemoparasite में 4 are protozoa and 4 are metazoa. Total 8 parasites are there. The 4 protozoa are Plasmodium, Babesia. Always they come together. They are brothers. Plasmodium and Babesia are the same category. They are sporozoans, right? Trypanosome and Leishmania. These are also brothers. Both of them are hemoflagellates. These both are hemoflagellates and these both are sporozoans. You may be knowing that. If you know the classification, look in the classification. You are having your sheet with you. Without sheet, you cannot understand the mnemonics. I always advise the student, first take a big sheet, make the complete classification on that sheet. Whatever parasites I am telling you in the mnemonic, just have a look कि वो कहाँ पे हैं. So that you will have a broad idea कि okay, these two are coming together, this one from here, this one from here. So you will have a better retention in your mind, right? So BPTL, the 4 parasites, the protozoas which are residing in blood. Now tell me the 4 metazoa. All of them are blood nematodes. I've told you nematodes में 3 categories: the intestinal one, the tissue one, the blood one. Blood वाले चारों बता. So Wucheria bancrofti, Brugia malai, Loa, and the 4th one is this Onchocerca volvulans. I've told you this classification. So don't learn the mnemonic. You already know the classification. Classification में ये hemoflagellate है. Hemo means blood ना. और sporozoans में ये दोनों blood में होते ही हैं. So there is no mnemonic for you, but yeah, you can learn like this. So these are the 8 parasites which reside in blood. So tell me the name of the hemoparasite. Hemoparasites are the parasites which reside in blood. Hemoparasites which reside in blood, right? So divide them into protozoa. How many protozoa? And divide them into metazoa. In the metazoa, basically they are nematodes, the blood nematodes. So tell me the name of the blood nematodes here. Blood nematodes are 4. How many blood nematodes you know? Wucheria bancrofti, Brugia malai, Loa, Onchocerca volvulans. Everyone give me a thumbs up. In the protozoa, let me come on the protozoa. Two of them are hemoflagellates. Only 2 hemoflagellates I have taught you now. What are the 2 hemoflagellates? Leishmania and Trypanosome. You may be knowing it. Leishmania, and those who are attending from the beginning, they know the classification. Leishmania and Trypanosome both are hemoflagellates. And 2 Plasmodium and Babesia, these are sporozoans. They also reside in blood. So these are the total 8 parasites, 4 protozoa and 4 metazoa, which are residing in the blood. Everyone gave me a thumbs up. So blood one are done. So let me come on the uro, which reside in urine. Urine में कितने होते हैं? Urine में 3 ही होते हैं. So Brugia, Wucheria bancrofti. So you can see Wucheria blood में भी है, urine में भी है. Wucheria bancrofti. Cystosomia, Hematobium, Cystosomia, and Trichinella Trichomonas vaginalis. So vagina and the urine, they are together now. So in the female, they reside in vagina also, they remain in urinary tract also. So vaginalis, right? Trichomonas vaginalis. So these are the 3 parasites which reside in urine. And name 3 parasites which reside in brain. So one is Tinea solium. which cause neurocysticercosis, the most important brain infection, and others are the amoeba. You know the three free living amoeba, तीनों बोल दो, Naegleria floweri, Acanthamoeba and Balmuthia. तीनों free living amoeba. So that is the parasites which reside in brain. I don't have any mnemonic for it क्योंकि मुझे ऐसे ही याद है. So how I remember them? Tell me the name of the parasites. If you want to make the mnemonic, you can make. But ऐसे भी ये easy है learn करना. It is not difficult. Just compile them. Tell me the name of the parasites which reside in blood. Okay. Tell me the name of the parasites which reside in urine. Okay. And tell me the name of the parasites which reside in brain, the neuroparasites. So these one are known as hemoparasites. These one are known as uroparasites, and these one are known as neuroparasites. Right? So tell me the mnemonics. If you have the mnemonic, tell me the mnemonic. Otherwise, learn like this only. Right? Brain में कौन कौन होगा? One is tinea. Which tinea? Solium or saginata? It is solium, not saginata. Solium one will enter in the brain and cause neurocysticercosis. The big one which causes autoinfection, not the saginata. In the option you will get both. That's why you will get confused. That's why I'm insisting on this point. It is tinea, solium, not saginata. And the three amoebas. What are the three free living amoeba? Free living amoebas के नाम बताओ. I have taught you in the classification. Those who are attending from the beginning, they know the classification. Tell me the name of three free living amoebas. Three, not pathogenic amoeba. Pathogenic amoeba is only one antamoeba histolytic. I'm not asking about it. The three free living amoeba: Naegleria floweri, Acanthamoeba, and Balmuthia medralis. So total 4 parasites in the world, they enter in brain. 3 amoebas, the free living amoebas, they enter in the brain and causes encephalitis and meningitis, and 1 tinea. Tinea solium causes neurocysticercosis. In the brain, one more question is asked in your exam. Tell me the most common brain infection of the parasite in human. So answer is this. Among these, the most common is this one. Tinea solium, that is neurocysticercosis, is most common neuro infection, brain infection in human by parasites. And most common symptom is scissors. Humans have scissors. Everyone give me a thumbs up. Everyone. Let me come on uroparasite. Urine में कितने होते हैं? So in urine only 3 are there. How you will? If you are confused, make some mnemonic. Make some mnemonic. Without mnemonic, if you are confused, you can make some mnemonic. Uroparasite only 3 are there. One is Wucheria bancrofti, one is Cystosomia, and one is Trichomonas vaginalis. In the female, from the vagina, they enter in urine. You can learn like that. From the vaginal secretion in the female, they enter in urine. So one is vaginalis, one is Wucheria bancrofti, दोनों जगह है. It comes in hemo also, it comes in uro also. And one is Cystosomia. Everyone give me a thumbs up. Hemoparasites पे आते हैं. We divide hemoparasites into 2 categories. Tell me 4 protozoa, which resides in blood, and tell me 4 metazoa. Metazoa में tell me 4 nematodes which resides in blood. So metazoa are easy. मुझे metazoa easy लगते हैं, तो let me write the 4 metazoa. The 4 nematodes, the blood nematodes. Tell me the name. Wucheria bancrofti. What is the first one? Brugia malai, Loa, and Onchocerus volvulans. You may be knowing in the classification only, right? Tell me the protozoa. Protozoa I forgot. कौन-कौन से protozoa blood में थे? The 2 hemoflagellates. What are the 2 hemoflagellates? Leishmania and Trypanosome. Leishmania and Trypanosome are the 2 hemoflagellates, and 2 sporozoans, Plasmodium and Babesia. That's it. If you want to make some mnemonic, it's good. If you don't want to make some mnemonic, it is the common sense. But you have to gather them together so that if exam में question आ रहा है, you can crack it easily. You can crack it easily. Tell me hemoparasites, tell me uroparasites, tell me neuroparasite. The parasite which reside in blood, urine, and brain. You have to give me a minute to compile them so that in the end we can do the revision. ना मुझे भी note करना पड़ता है तुम्हारे साथ. So tell me the parasites which reside in blood, which reside in urine, which reside in brain. Right? So we are done till now. इससे पहले हमने क्या देखा था? Okay, auto-infection तक हो गया था. Coming on the next mnemonics. Are you people there? Should I continue the series or should I end it here? Should I continue? Till now I have given you many mnemonics. Should I continue it? Okay. Tell me the host. अब कुछ mnemonics host पे हो जाए. Parasite पे तो बहुत mnemonics हो गया. We have done multiple parasites, multiple mnemonics on the parasite. What is a host? Tell me the host. Host is the organism. Host can be human, can be animal. Host is the organism inside which parasite is residing. So this is the parasite. The organism which resides inside another organism. So that organism is the host. Can you see? This is the host. So you can see parasite is the organism which resides inside the host and obtain 2 things from the host. Number 1, food. Number 2, shelter. Food and shelter. So basically, host is giving food and shelter to the parasite. Host is giving food and shelter. So this is a parasite. You can see inside. This is a parasite. This parasite is obtaining food also and shelter also by remaining inside the host. But so okay, host is giving food and shelter to the parasite. What parasite is giving to the host? Parasite is giving disease to the host. So host is giving food and shelter to the parasite, but parasite is giving harmful effect or disease to the host. Give me a thumbs up. You got the definition. What is the host? What is the parasite? Till now, I taught you many mnemonics on the parasite. The parasite which enter by sexual route, the parasite which enter by skin, the parasite which enter by vertical route, the parasite which cause autoinfection, parasite which cause anemia, parasite which remain in blood, which remain in brain, which remain in urine. Many mnemonics. Now have some mnemonics on host. होस्ट की बातें कर लेते हैं. Let me start host. Give me a thumbs up. Everyone give me a thumbs up. So host is the organism that harbors the parasite, that provides shelter to the parasite, that provides nourishment to the parasite. But on the contrary, parasite is giving disease to the host. So that is a host, right? Hosts are of two types. Now first learn the types of the host, then I will give you mnemonics on the host, right? The hosts are of two types, definitive host and intermediate host. Can you tell me the differences between them? What is the definitive host? What is the intermediate host? Host to समझ में आ गया. Host is the organism which is harboring the parasite. It can be human, it can be animal. So this is a parasite. The parasite is remaining inside the host. What do you mean by definitive and what do you mean by intermediate? Can anyone of you tell me? Yashwant, Sakshi, Samir, Payal, anyone? Anyone tell you? Can tell me definitive host or intermediate host? We cannot define it in one definition. There is no one definition. The definition for definitive host and intermediate host is different for protozoa, and the definition is different for metazoa. So that's why understanding classification is the must. Protozoa are the unicellular parasites, we have understood them. Metazoa are the multicellular parasites, we have understood them. Now what is the definition of definitive host and intermediate host here? And what is the definition of definitive host and intermediate host here? Can anyone of you tell me? Can anyone of you tell me yes or no what I am asking? So these are multicellular, no? Multicellular have larva. They have larva. Unicellular don't have larva. They don't have larva. They just divide by doing multiplication by not binary fission, but they multiply simply. They don't give birth to child. You know, they give birth to the child by giving eggs, and the egg will hatch, larva will come out. So there is no larva here. So here, the definition of the definitive host is the host in which parasite is performing sexual function. And the intermediate host is the host in which parasite is performing asexual cycle. Sexual cycle, definitive host. Asexual cycle, intermediate host. Give me a thumbs up. Here in Metazoa, definitive host is the host in which adult form is remaining. And intermediate host is the host in which larva form is remaining. So give me a thumbs up if you got the definition. Everyone give me a thumbs. यहाँ पे larva है तभी तो larva form बोलेंगे. Give me a thumbs up. Give me a thumbs up. No, intermediate is not a carrier, Yashwant. No, carrier host is a third type of host. So carrier host, you can say it is a third type of host which only carries from intermediate to definitive or definitive to intermediate. So only transport का काम करेगा carrier host. Give me a thumbs up. It is not, but none of them is carrier. Definitive host, intermediate host. So the definitions are different. If you talk about protozoa, these are the definitions. So definitive host is the host inside which sexual reproduction takes place. Intermediate host is the host inside which asexual reproduction takes place. Fertilization. Sexual means fertilization. So here fertilization takes place. Here no fertilization takes place. Only asexual cycle. For helminth, that is metazoa, what are the definitions? Definition: definitive host is a host which harbor the adult form of the parasite, which gives shelter to the adult form of the parasite. And intermediate host is the host which harbor larva form of the parasite. So this is the summary. Tell me the definition. So पहले तो समझो host क्या होता है. What is a host? Host is an organism which give food and shelter to the parasite. On the contrary, parasite is giving disease to the host. So that prani, that organism is known as host. Now there are two type of host: definitive and intermediate. So but the definition for protozoa and metazoa differs for definitive and intermediate. Can you tell me the definitions for protozoa? Protozoa के लिए क्या definition है? Definitive host is a host in which sexual cycle, that is fertilization, takes place. Inside which host the fertilization takes place, that host is a definitive host. And intermediate host is a host inside which asexual cycle takes place, that is no fertilization takes place. For helminths, the definitions are different. Definitive host is a host which harbor adult form of the parasite, and intermediate host is a host which harbor larva form of the parasite. Now you can imagine how beautifully the examiner can frame the questions and put in front of you. So what is the definitive host for protozoa? The four options are in front of you. What is the intermediate host for protozoa? The four options are same in front of you. What is the definitive host for helminth or metazoa? The four options are in front of you. And what is the intermediate host for metazoa? The four options are in front of you. Give me a thumbs up. Now you don't get confused. You don't get confused. Now, and a carrier host, which someone among you was saying, na, carrier host is the transport host. It is neither definitive host nor intermediate host. It is known as parathenic host. Parathenic host, carrier host, transport host, one and the same thing. इन सब का मतलब एक ही है. इसमें only the parasite is transported from one host to another. It is only doing the job of transport. There is no sexual or asexual cycle. Neither sexual nor asexual. Give me a thumbs up. Give me a thumbs up. So that is the thing. Now in the life cycle of the parasites, some parasites only have one host. Some parasites have two hosts. Some parasites have three hosts. The one parasites who have only one host in their entire life cycle, it is known as simple life cycle. The life cycle is simple. The one host in which the host total hosts are two or three से ज़्यादा कभी नहीं होंगे, maximum three. So the two or three, this is known as complex life cycle. The life cycle is complex. Simple or direct life cycle in which only one host is there, and complex or indirect life cycle in which multiple hosts are there, either two or three. Give me a thumbs up. So life cycles are of two types in the parasites. Some parasites only one host, they complete their entire life cycle in one host. So the life cycle is simple or direct. Some complete their entire life cycle either in two hosts or three hosts, that is multiple hosts. It is not singular, it is plural, multiple hosts. So this is complex or indirect. When only one host is there, it is always definitive. Definitive host होगा. अगर एक ही है तो वो definitive ही होगा. अगर दो हैं तो one is definitive and one is intermediate. So total two will be there. If three हैं तो क्या होगा? You tell me क्या होगा? One will be definitive and two will be intermediate. Intermediate में first intermediate, second intermediate. Give me a thumbs up. These are the basics. If you don't know the basics, you can't understand ahead. So learn means understand. Don't learn it, understand it. So I'm talking. So you understood host. Host के बाद the next thing you should understand is the life cycle. In the life cycle, you should understand there are three types of life cycle: the simple direct life cycle and the indirect life cycle, the complex one. In simple life cycle, only one host is there, singular. And complex and direct में multiple में maximum, minimum two, maximum three से ज़्यादा नहीं होंगे. If only one host is there, it has to be definitive. If two are there, one is definitive, one is intermediate, always. And if three are there, definitive तो एक ही रहेगा, but intermediate will be first intermediate and second intermediate. Give me a thumbs up. Give me a thumbs up. Now, so I have already told you what is simple or direct. Only one host. There is always. So you have to learn the name of the parasites which comes in your exam, which have only one host. इनके नाम याद करो. Learn the name. I will give you a mnemonic. Learn the list. They have only one host. So learn the list. The list should be at the tip of your tongue. They only have one host. Learn first mnemonic मैं यही दूंगी. Name of parasites which have only one host. So see, this is the list. This is the list. Simple life cycle. Only one host. Only one host. So among protozoa, these are the organisms. Among metazoa, these are the organisms. So this is the list. They have only one host. They have only one host in their entire life cycle, and that host is the definitive host. They don't have any intermediate host. So you can get the MCQs like this. From the four options given below, tell me the name of the parasites which is having only one host in the entire life cycle, that is have only definitive host. Only definitive host. Or you can get the question like this. Tell me the name of the parasite from the given four option which do not have intermediate host. No intermediate host मतलब other way they are saying only one host. डायरेक्ट ना बोल के इनडायरेक्ट बोलेंगे. सो ये सारे पैरासाइट्स में नो इंटरमीडिएट होस्ट. इट इज द लिस्ट ऑफ द पैरासाइट व्हिच इज हैविंग नो इंटरमीडिएट होस्ट. दैट इज दे हैव ओनली वन डेफिनेटिव होस्ट. So question can be anything. Tell me the name of the parasite which is having one host, one definitive host, or no intermediate host. The answer is same. So the list is in front of you. Everyone give me a thumbs up. The big thumbs up. Give big thumbs up. So from protozoa, you can see the list. From amoeba, it is only one amoeba, Entamoeba histolytica. From spores, flagellates, the two flagellates, Giardia and Trichomonas. Right. From ciliates, only one ciliate, Balantidium coli. Right. From sporozoans, these are the four sporozoans. Right. So the four spora: cryptospora, cyclospora, isospora, microspora. So all sporas are there. The four sporas. Give me a thumbs up. Make some mnemonic, or you can learn ऐसे भी learn कर सकते हो. From helminth, cystode में एक ही cystode है, H nana. और nematode में all the intestinal nematodes are there. Ascaris, you know, Ankylostoma duodenale, that is hookworm, right? Antrobius vermicularis, Trichura, Trichuris strongularis, ये सब intestinal वाले हैं. Blood वाले नहीं, tissue वाले भी नहीं. Only intestinal. And there is no trematode having cystodes are there, nematodes are there, लेकिन trematode में एक भी नहीं है which is having one host. It is always having multiple host. Give me a thumbs up. Give me a thumbs up. So learn. इसमें से maximum MCQs तुम्हारे बनेंगे. Please understand. If you know the classification, have a look on your sheet. You have classification in your hand. If you have a look. ये सब ढूंढो कहाँ कहाँ पर है. So that is about the simple host. So simple host पे यही question आता है. Simple host पे tell me the name of the parasite which is having simple life cycle. One host, that is definitive host, no intermediate host. उसका list याद करो. Learn the list. From the protozoa, what are the organism? From the metazoa, what are the organism? Everyone give me some, give me a thumbs up. Now coming on multiple host, that is complex or indirect life cycle. तो इस पे क्या क्वेश्चन आएगा? Now ideally you should learn the list of the organism which is having two, one definitive, one intermediate, or list of the organism having three, but it is very difficult to learn. It is very difficult. I will show you the list. Let me show you the two list now. Two host or three host वाली list दिखा देती हूँ, but it is difficult to learn, practically impossible to learn. So this is a list of two host वाली. So all these are the parasites. This is the definitive host and this is the intermediate host. So one definitive, one intermediate, total two host, right? So this is the list. You can read the list, and this is the list from Protozoa and the same list from the Metazoa. This is the definitive host, one definitive host and one intermediate host. So total two hosts are there. So the list is very big, very large. You can see two host ki list. ये Protozoa में से हो गए. These all are from Protozoa and these all are from Metazoa. Metazoa में से भी cystodes, trematodes, nematodes. The list is extensive, difficult to learn, almost unable to learn, right? But at least read it before. I'm not asking you to rutification karo or make some mnemonic. कितने mnemonic बनाओगे? You cannot do it. But at least read it. You should know the names की इन सब के दो host होते हैं, one definitive, one intermediate. And this is the list of three hosts. This is the last list of three hosts. So one will be definitive host and two will be intermediate host. This is first intermediate host and this is second intermediate host and this is one definitive host. So total three hosts are there. This is the list of the parasite, complete list. ये वाली list ज्यादा important है. इसमें exam में question क्या आएगा? Any parasite will ask you. If you see the PYQs, any of the parasite will be asked. For Diphylodon brothum, what is the first intermediate host? What is the second? Exact examiner want to ask you first intermediate और option में तीनों होंगे. Option में cyclope भी होगा, fish भी होगा और man भी होगा. So you have to pick the first, or the question will be for Diphylodon latum, what is the second intermediate host? What is the definitive host, right? So for all these parasites, you should know clearly what is definitive, what is first intermediate, what is second intermediate. Give me a big thumbs up. Everyone give me a thumbs up. Everyone. So don't mug up, but at least read it twice or thrice. If you give 2-3 reads before your exam, now by looking at the 4 options in the MCQ, it will click in your mind. Now your exam is an objective exam. It is not a subjective exam. In an objective exam, options are in front of you. The only thing you should pick from that. Options are only 4, A, B, C, D. You have to pick what is the correct. The 3 are wrong, 1 is right. So if you read this list 2, 3, 4 times before going to your exam, even not learning it, not making mnemonic, just reading and casually going in the exam, it will click in your mind. I can guarantee it will click in your mind. If you read it, ki the first host is the hand, snail and second is the aquatic plant, तो एग्जाम में क्लिक करेगा कि नहीं, मैंने जो लिस्ट देखा है उसमें स्नेल पहले आ रहा था, एक्वेटिक प्लांट बाद में था, तो स्नेल फर्स्ट होगा, एक्वेटिक प्लांट सेकंड होगा, वो ऑटोमेटिकली दिमाग में आएगा. So don't try to mug it up, right? Read it 2-3 times. So till now I have given you 3 lists. So let me start host, right? Not host. Let me teach you the life cycle. In life cycle में अभी तक हमने क्या पढ़ लिया? There are 3 type of life cycle. The life cycle in which only one host is there, the life cycle in which 2 hosts are there, the life cycle in which 3 hosts are there. If one host is there, that means only one definitive host, or you can say no intermediate host. No intermediate host, दोनों पे क्वेश्चन आता है, मतलब सेम है, right? 2 में 1 will be definitive host and 1 will be intermediate host, right? Or 3 में 1 will be definitive host and 2 will be intermediate. So first intermediate host and second intermediate host. Exam में if you see the PYQ, maximum questions will be from this and this. इस पे इतने क्वेश्चंस नहीं है, राइट? सो इन दिस यू शुड नो द लिस्ट. इसको लर्न कर लो, लर्न दिस लिस्ट, मेक सम mnemonic, लर्न दिस. प्रोटोजोआ में से क्या, मेटाजोआ में से क्या, राइट? इस लिस्ट में से एटलीस्ट रीड. इट इज आल्सो अ स्मॉल लिस्ट, यू कैन लर्न दिस लिस्ट. जस्ट रीड इट. गिव मी अ थम्स अप टिल नाउ if it is okay. If not, it is okay. Now the next list I am coming, I will give you all the list together. The next list which I am coming, what I am giving you the next list, first understand, फिर मैं लिस्ट दिखाती हूँ. वन होस्ट है, उसको तो छोड़ो. Come on, 2 and 3 host. 2 and 3 host. Let's talk about 2 hosts. Let's talk about 3 hosts. लाइफ साइकिल में 1 होस्ट को छोड़ दो, 2 होस्ट और 3 होस्ट को पकड़ो. टेल मी समथिंग. आई वांट टू टेल यू समथिंग अबाउट द 2 होस्ट. एंड इफ इट इज 2 होस्ट, 1 इज डेफिनेटिव as I have told you and 1 is intermediate as I have told you. If 3 hosts are there, definitive is always 1, others remaining will be intermediate. So intermediate will be 2. This is first intermediate and this is second intermediate. Do you have any doubt in this? No one have any doubt. Definitive host is 90% time humans. So man is the definitive host. Intermediate host will be some other organism. It can be any animal, it can be any organism. Here also definitive host is man, but man is the definitive, man or human is the definitive host 90% time. Tell me the exceptions in which man is not a definitive host, man is the intermediate host. उनके एग्जांपल दिखाओ. अब आई एम टेलिंग यू, आई एम शोइंग यू द लिस्ट अगेन ऑफ 2 और 3 की लिस्ट. फिर से देखो, उसमें से वो पिक करो जहां पे मैन इज नॉट डेफिनेट. दिस इज द लिस्ट ऑफ 2 होस्ट. सी द लिस्ट ऑफ 2 होस्ट. So in the list of the 2 hosts, this is definitive host, this is intermediate host. See, definitive host में यहाँ पे man है, यहाँ पे man है. I want to know the exception. So where is the exception? These three are the exception. Where man is not a definitive host, something else is the definitive host. So take these exceptions. You got my point. Man is not a definitive host. See the entire list. Maximum जगह पे man है, definitive host. Only here, dog. So this is the exception. So यहाँ से ये तीन exception मिले where man is not a definitive host और यहाँ से ये एक मिला जहाँ से man is not a definitive host. ये तो two host हुआ. Come on the list of three host. Three host में maximum time man is the definitive host. This is the exception. This is the exception. So all exceptions together, this is the mnemonic. Where man is not a definitive host, man is the intermediate host. 99% time man is a definitive host. Only 1% time man is not a definitive host, man is the intermediate host. So tell me the list of these in which man is not a definitive host, man is the intermediate host. Inki list batao, that is important. Exceptions are important for your exam. Examiner loves to ask question on exceptions. Give me a big thumbs up. Give me a big thumbs up. Come on, everyone. I want a thumbs up first. Should we make a mnemonic? So the mnemonic is best. The mnemonic is best. Just a second. Man. Okay. Best. What is B? Okay. Let's complete it. What is B? B is Babesia. What is E? E is Echinococcus granulosus. अब वो पीछे लिस्ट में जा के देखो ना. Where is Babesia? Here is Babesia. Plasmodium के साथ Babesia यहाँ नहीं लिखा है. So Plasmodium, Babesia occurs together, right? So here in the list you can see Plasmodium, Babesia, Echinococcus, Toxoplasma, right? Okay. B is Babesia, E is Echinococcus, S आपका दो S है. One S is Pyrometra and one is T. T is Taenia solium. Again ये solium है, Saginata नहीं है. Solium में it is man is the intermediate host, not in Saginata. Solium only causes neurocystic sarcosis और solium में auto infection में भी है. Auto infection में भी solium है, Saginata नहीं है. In the auto infection you have solium, not Saginata. In the neurocystic sarcosis, brain parasite, you have solium, not Saginata. In the man secondary host or intermediate host also you have solium, not Saginata. So your answer is solium, not Saginata in all these questions, right? So T, there are two T, one Toxoplasma, one Taenia, right? And there are one P. One P is Plasmodium now. Okay. And one, there are two S, Pyrometra and Sarcocystis. Give me a thumbs up. I'm writing it again. Don't worry. If there is confusion, let's write again. Best, pest, PST, PE nahi hai. Best, pest is the mnemonic. Let me write this mnemonic also. Best, pest. Itne mnemonic hai ki even I forgot. So I have to write it down. Best, pest is the mnemonic. So say the full form. So B is Babesia. Let me write the full form. B is Babesia. P is Plasmodium. The two brothers, Babesia and Plasmodium, they always come together, right? Two T are there. One is Taenia solium, one is Toxoplasma. Taenia solium and Toxoplasma. E is Echinococcus and two S are there. Two S is Sacrocystis and Spirometra. Give me a thumbs up. So learn this list. इस पे बहुत previous year question papers मिलेंगे आप सबको. You will get maximum questions on this list. Should I proceed ahead? Should I proceed? Okay. I got the list. This is the list. So in this list, what is the summary? So you got the summary. You will say, ma'am, in this list, man is not the primary host, definitive host. Man is the intermediate host. So my next question, who is the primary host in them? Man is not. But tell me the organism who is the primary host. So man is not there, but who is there? So in Plasmodium, the answer is mosquito. Right? So likewise, you tell me the name of the definitive host in all of them. Man is the intermediate host, I agree. But who is the definitive in each of them? So for Plasmodium, it is mosquito. Mosquito may be concept mosquito. It is not Culex mosquito, it is Anopheles. Anopheles may be female. Mosquito may be male female hota hai. Mosquitoes also have sex. Mosquitoes also have gender. They also have male female. So it is a female Anopheles mosquito being very specific. Babesia it is tick. In Sacrocystis it is cat and dog. In Toxoplasma it is cat. In Echinococcus it is dog. In Taenia solium man is both. Man is both. Now in the list tell me the full forms. So tell me, you got my point. So first tell me the mnemonic. Man is intermediate host or secondary host. Not definitive host. सबका मतलब एक ही है. If you are getting the question, tell me the name of the parasite in which man is the intermediate host. Tell me the name of the parasites in which man is a secondary host, or tell me the name of the parasites in which man is not a definitive host. The list is same. The mnemonic is pest 4 plus 3. Pest. So total 4 plus 3, total 4, 5, 6, 7. 7 parasites are there. So this is Babesia. This is Plasmodium. Right? This is Echinococcus granulosus. This is Toxoplasma. This is Taenia solium. The two S are not important. You can leave them. On you can learn the Spirometra and Sacrocystis. These are the two S. Right? Now tell me, okay, I got it. Man is not a definitive host. Man is the intermediate host, right? Intermediate host or secondary host. So secondary host in all of them is man. I got it. Man, 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 man. Tell me the definitive host in each of them. Mnemonic के साथ definitive host भी बताओ. You got my point. So that is the completion. That is the completion. For Babesia, the answer is tick. For Echinococcus granulosus, the answer is dog. For Toxoplasma, the option is dog plus cat both. For Plasmodium, it is mosquito. Which mosquito? Don't say only mosquito at your level. It is Anopheles. It is female Anopheles mosquito, right? For Taenia solium, man. Man दोनों जगह है. Man is the definitive also. Man is the intermediate. इस पे भी बहुत question होता है. Tell me the name of the parasite in which man is acting both. Intermediate also definitive host. The 2S you can look by yourself. I forgot. I am not remembering the 2S. Everyone give me a thumbs up. I tried hard. I tried hard. So best is the mnemonic. So what is the summary? Learn the mnemonic best. First learn the mnemonic. सबसे पहली बात. The second thing, learn the full form of the mnemonic. In the full form of the mnemonic, learn the full form. After that, in all of them, man is the intermediate host. Then learn the definitive host of each of them. So question can be anything. You can't imagine कितने questions आ सकते हैं. I want appreciation by all of you. I'm really doing I feel that I'm doing a hard work. So to simplify the concepts for you, right? It really needs a hard work to take a class for 3 hours. At least I have to give 2 hours before the class to prepare all these material, to simplify the material for you. I have taken at least, you can't imagine, I have opened 7 books, the 7 soft copies of the books, and compiled that mnemonics from all the books at one place, gathered in a PP and presenting in front of you, so that you get all the things at one place, that is on Unacademy, right? So this is really hard work. You should give the appreciation. Should I proceed ahead? So this was the mnemonic. If you got the mnemonic, now the mnemonics are over. After that, I am having some clinical pointers on some parasitic disease, right? There are many more lists ahead. So let me revise some mnemonics and then we will move ahead. Till now, what we have learned. Give me a minute. Okay, just list. We will not say the full forms. You tell me the list. So tell me the name of the parasites which show antigenic variation. Tell me the name of the parasites which enter human by skin. Tell me the name of the parasites which enter human by sexual route. Tell me the name of the parasites which enter human by vertical route, that is transplacental or congenital parasites. You can say congenital parasites. Congenital parasites. Tell me the name of the parasites which resides in muscles. Tell me the name of the parasites which causes auto infection, right? Tell me the name of the parasites which causes malabsorption, right? Okay, let me divide it. Ruko, 1 minute ruko, give me a minute to divide these columns. Okay, divide the page into 2 categories. The page is small now. Okay, we will continue. Tell me the name of the parasites which causes anemias. Tell me the name of the parasites which causes, okay, auto infection यहाँ पे है, तो ये क्या था? Okay, acid fast. Okay, acid fast parasites. Tell me the name of the parasites which are acid fast, and tell me the name of all organisms which are acid fast, not only parasite. 2 different mnemonics are there, right? After that, auto infection ho gaya. Tell me the name of the parasites which reside in blood, hemoparasites which reside in urine, uroparasite which reside in brain, the neuroparasite, right? Tell me the name of the parasites in which man is acting as an intermediate host or secondary host or not a definitive host. Not definitive host. Tell me the list of that. Give me a thumbs up. Till now we have covered, और बीच बीच में small मैंने छोड़ दिया. Everyone give me a thumbs up. This is the complete list. This is the summary. First give me a thumbs up. पहले तो thumbs up दो, उसके बाद full form बोलो. Appreciate. Till now we have completed these many mnemonics. You can count how many we have completed. So appreciate it. Give me a thumbs up and let's start. So tell me the name of the parasites which show antigenic variation. The mnemonic is GTP. Full form I'm not saying, you say it yourself. You know the full form of GTP, I am assuming it. Tell me the name of the parasites which reside in skin. Which reside in skin, which not reside in skin, which enter the human body by penetrating skin, by penetrating human skin. So tell me the name of parasites. The name of the parasite is Hans. HANSS. Hans. You may be knowing the full form. Tell me the name of the parasites which transmit from one human to another by sexual intercourse. So sexual parasites, get it sexually, GET, get is the mnemonic. Learn like that, get it sexually, GET. Tell me the name of the parasites which causes congenital parasitic infection because they spread from mother to fetus by placenta. That is vertical route. The question placenta pe aaye, vertical route pe aaye, ya congenital pe aaye. It is same. What is the mnemonic? Yes, so Payal, Sakshi, Jaypriya. Some students are participating. What about others? Why others are not participating? You are attending the lecture from the beginning now. So tell me the full form. तो वर्टिकल इज फ्रॉम मदर टू फीटस. मदर से मुझे याद आएगा पेरेंट. मदर इज अ पेरेंट. सो पेरेंट टू टीचर मीटिंग, PTTM. You may be knowing the full form, PTTM. Tell me the name of the parasites which reside in muscle. What about others? Others also participate. I want every student to write down in the chat box. Why only Payal is participating? What about others? In front of me, there is a big screen. I can see your chat on the screen. Yes. Tell me. What about others? Yes, Sakshi. So, okay, with the one parasites which reside in muscle is T4. 1, 2, 3, 4. T4E. Yes, very good, Payal. It is T4E. Name of parasites which causes auto-infection. Yes. So, the name of the parasites which causes auto-infection is chest. CHEST, chest. Name of parasites which causes malnutrition. Malnutrition in humans. What's the name of the parasites which causes malnutrition? Strong Gia cry for Philip. So strong Gia. Gia is a strong girl. She is crying for Philip. Philip. So this is the mnemonic. You know the full form, I guess. Right. Tell me the name of the parasites. Okay, let me change the color. Tell me the name of parasites which causes anemia. Anemia. So it is Punjab and and Bangalore. Punjab and Bangalore League team. Punjab and Bangalore League team. Punjab and Bangalore League team. Right. So learn the full form. Learn the full form. Tell me the name of the parasites which are acid fast. 4 sporas. Sporas. What are the 4 sporas? Microspora, isospora, cryptospora, cyclospora. So 4 sporas. The mnemonic is spora. The mnemonic is spora. Right. Tell me the name of the parasites, not parasites, all organisms which are acid fast. No longer separate booking. RIM, SIM card. RIM, SIM card. You know the full form, I guess. यहाँ पे I आपका isospora है ये वाला. Right. And all sporas. Tell me the name of the parasites which reside in blood. Four protozoa, 4 metazoa. There is no mnemonic, but you know the names. Urine parasites are only 3. Wucheria bancrofti, cystosoma, and Trichomonas vaginalis. So WST is the mnemonic for urine. Make some mnemonic WST. Wucheria bancrofti, cystosomia, and Trichomonas vaginalis. So these are the 3 urine parasites. Or brain में total 4 parasites हैं. What are the 4 names? One is Tinea solium, which causes neurocysticercosis. You cannot afford losing it. You cannot afford missing it. It is the most common parasitic infection in brain in humans. Tinea solium, not Saginata, and other 3 are free-living amoebas. That is Nigleria floweri, Acanthamoeba, and Balmuthia mandralis. Give me a thumbs up. Everyone give me a thumbs up. Now tell me the name of the parasites in which man is not a primary host. Man is not a definitive host. Man is a secondary host or intermediate host. What is the name of the parasite? The mnemonic is pest. PST. Pest. Say the full form. Not only say the full form. After saying the full form, tell me who is the primary host in each of them. Who is the definitive host? Man is not the definitive host. Man is the secondary host. So man is the secondary host in each of them. I know who is the primary. For Babesia, it is tick. For Echinococcus granulosus, it is dog. Right? For Tinea solium, it is man only. Man is both. Man is both in Tinea solium. For Toxoplasma, it is dog or cat both. For Plasmodium, it is mosquito. Mosquito, the female Anopheles mosquito. Right? So learn like this. Everyone give me a thumbs up. Everyone. I really put my best efforts in teaching you, in giving you, in bringing all these mnemonics till you. So everyone give me a thumbs up and appreciate it. Now, in this mnemonics, one take care point. You know what I'm going to tell you. The one take care point is that there are many T. So what is this T? What is this T? What are these 2 T? What are these 4 T? What is this T? You can imagine what is this T here, right? Where is the next T? Where is the next T? You can see this T and you can see these are the 2 T's. So these T's will create nuisance in the exam. So take care of these T's. Say the full form. T बहुत सारे हैं, right? Tinea solium, Tinea saginata, Toxoplasma, Trypanosoma, and the Trachinella spiralis. There are many T. So please take care of all these. How to remember many mnemonics? Harpreet Kaur. I don't have any idea about it. The mnemonics are to simplify. If you are asking ki ma'am how to study parasitology, my answer is to learn the mnemonics. But if you are asking how to learn mnemonics, just write down. Okay. The best way how I do, Harpreet, is that I teach someone. I'm teaching you. I'm teaching many students the same mnemonic. If I say and teach it someone now, so you will never forget. Once you read it, you can forget. Once you write, you can forget. But किसी को पकड़ के एक बार बता दो ना, कभी नहीं भूलोगे. So today your batchmate, your roommate, your junior, your senior, किसी को भी पकड़ लो, बोलो आज तुमको एक बहुत अच्छी बात बताता हूँ. I will teach you entire parasitology in just 10 minutes. Give me 10 minutes. Take a copy, take a pen, and write down all these mnemonics as I have written in front of you. Now you write down in front of someone else and say the full forms. Try to say. If you are confused, open it, see the full form, just see it, and then it will fit in your permanent memory, and the other person will always bless you. Okay, you have told me a great point, good. So he will thank you, he or she will thank you, right? Okay. Bacteriology KB hai. Yes, yesterday Harpreet, you have missed my lecture, that's why you are asking this question. Yesterday I have taken the complete mnemonics of bacteriology. Watch my recording, it is available on the YouTube, the same YouTube channel where you are watching it right now. So on the same YouTube channel, that is Unacademy Live, yesterday's lecture, bacteriology 2-hour lecture I have taken, and I have given more than 30-40 mnemonics in the entire bacteriology. Please watch it, it is a must watch, you cannot afford missing it, right? So bacteriology ho gaya, parasitology ho gaya, I am having it for pathology also, and complete pharmacology also, complete medicine also. I am having multiple mnemonics for you. So mnemonics will make your life easy, right? Mnemonics will make your exam easy. Okay, let's move ahead. Harpreet, can I move ahead? Should I move ahead? Okay, I should. So these were the mnemonics. वो पेज गया, अब फिर से नहीं आएगा. Say the full forms, learn it. I have given the mnemonics. Let me move ahead. Let me teach you some clinical pointers in some parasitic disease. What do you mean by that? Now, in the new pattern, in the latest and new pattern of most of the exams have shifted from one-liners to clinical questions. Now, in exam, you get most of the questions are clinical big questions. You get clinical big lengthy questions. So in the clinical big lengthy questions, there are some important points that is pointing towards some of the important parasitic disease. For example, in your question, if you are getting solitary liver abscess, the examiner means Entamoeba histolytica. Entamoeba histolytica is the only parasite which causes solitary liver abscess. In your question, if you are getting watery diarrhea and blotting in the clinical history, the examiner is pointing you towards the Giardia lumpia. If examiner giving you partial scissors in the brain or cyst in the brain, only one parasite causes scissors or cyst in the brain, Taenia solium, because of neurocystis surface. If the examiner is giving you liver cyst, not liver abscess alag hai, liver mein cyst alag hai, hydrated cyst, examiner is pointing you towards echinococcus granulosus. These things are important in big lengthy. You have lengthy questions now, the lengthy big clinical questions in which you get confused in the 4 options. When the examiner is giving you some biliary tract disease or tumor in the biliary tract, tumor in the bile ducts, examiner is giving you a clue that he is talking about Planochus sinensis. When the examiner is giving you hemoptysis, that is blood in sputum, only one parasite causes blood in sputum, hemoptysis, that is the lung parasite. The lung parasite is Parognemus westermani. It is a lung parasite. Give me a thumbs up. Give me a thumbs up. If the examiner give you some parasite causing portal hypertension in a human, there is a 46-year-old male presenting to your clinic. If you have examined the patient, you have found esophageal varices, you have found the hemorrhoids, you have seen the patient is having portal hypertension, you have found some parasitic infection, name the parasite. So it will be a big question, right? Not one liner, right? So the examiner is pointing you towards Schistosoma mansoni. That causes portal hypertension, right? So these are the one clues. You can say these are the clues in the question that will point you towards some important parasites. Give me a thumbs up if examiner gives you hematuria, that is blood in urine, not blood in sputum. Blood in urine कौन कराता है? Only one parasite causes blood in urine, that is Schistosoma hematobium. ये Schistosoma mansoni था, ये Schistosoma hematobium है. The two are schistomas, the two types of schistosoma. This schistosoma causes portal hypertension and this schistosoma causes hematuria. Give me a thumbs up. Give me a thumbs up. Everyone, give me a thumbs up. Only one parasite goes in heart. You must know the name. Heart, esophagus, and colon. Causes mega dilatation of the heart, dilatation of the esophagus, dilatation of the colon. Dilatation of the esophagus is mega esophagus. Dilatation of the colon is mega colon. And dilatation of the heart is dilated cardiomyopathy. Give me a thumbs up. Dilatation of the 3 organs. Heart, esophagus, and colon. Heart is dilated cardiomyopathy. Esophagus is mega esophagus. Colon is mega colon. It is the PYQ. It is already asked in NEET PG few years back. The answer is Trypanosoma cruzi. It is not bruzi. It is cruzi. Trypanosoma bhi do hote hain, cruzi, bruzi. So answer here is cruzi. Give me a thumbs up. Give me a thumbs up. The last one is perianal pruritus. You know, pruritus means itch. Itch. It's a bad thing. It usually occurs in children. And children used to touch their anal area. It occurs usually in small children, 3 to 5 years of age. So what the children will do? He's a child. The child frequently touch the anal area and itch here, always itch here. So the parents are bothersome that why the child is touching and itching on the perianal area. So typical complaint, perianal itch. A child with a perianal itch. The answer is Antropius vermicularis, that is known as pinworm. Pinworm. Everyone give me a thumbs up. Everyone. I'm really trying hard. So these are the clinical pointers, or you can say the clues for your question. In your big question, when these words are written, the examiner is pointing you towards these parasites. So from the options, you should compile it with other clues given in the question, but mostly the answer will be this. Everyone give me a thumbs up. You got my point? You got my point? Now I'm giving you a list of parasitic tests. A list of parasitic. Have a look. Have a look. So this is the list of the parasitic list test. Okay. Okay, so the first test is the string test, also known as antero test. It is obsolete nowadays. We don't perform string tests. You may be knowing what is a string test. We take an empty capsule, the gelatin capsule, and we tie the capsule with a thread, right? We ask the person to take the capsule with water. So the capsule will go inside the stomach, and in the duodenum, the thread is in your hand. One end of the thread is in your hand. You're getting my point? You know what is string test? I guess you may be knowing what is string test. So this is the human in which I want to perform the string test. I want to take the duodenal aspirate. Let me draw. This is the mouth. This is the esophagus. This is the stomach. And this is the duodenum. I want to take the duodenal aspirate, right? So I'm having a capsule. I will tie the capsule with a thread. It is a big thread, right? I will ask the person to take this capsule. To take this capsule via mouth, right? So person will take the capsule will go here, 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 here. You keep the length of the thread, this only that capsule reach in the duodenum and stop, not going ahead. So capsule is going in the duodenum and capsule is dissolving in the duodenum because capsule is made up of gelatin. So you have one end of the thread in your hand. Don't let ये पूरा thread अंदर मत चले जाने देना. This is a nylon thread, right? Don't put only it is taking here. So this is the capsule and this is the thread. The thread, one of the end is tied here on the chick. यहाँ पे cellotape से चिपका दो and keep the capsule will dissolve. So the thread will remain in the duodenal aspirate for few minutes. For few minutes, for half an hour, keep the thread there only. The thread, the capsule is dissolved. Only you have thread. The thread is there in the duodenal aspirate. The duodenal aspirate में उसको dissolve होने दो. Then take the thread out. Take the thread out. Take a test tube. Take saline in the test tube. Put this end of the thread in the saline, so that whatever duodenum aspirate is sticking on the thread, it will get dissolved in the aspirate. Now इस aspirate से test करो. Make a slide, centrifuge it, and do the test. So this is how you have taken duodenal aspirate out without doing any invasive test. Oh, this test is known as string test. Give me a thumbs up. I guess you may be knowing it. इसमें पढ़ा जब भी तुम्हें किसी some of the educators have taught you parasitology now. So that test is known as string test or antero test. It is done for which parasite? It is done for 3 parasites: Giardia, Cryptosporidium, Strongyloids, and Parahemolyticus vibrio. Parahemolyticus vibrio is a bacteria, and these 3 are the parasites. You can learn like Gia cried strongly during PV, per vaginal examinations. Gia is Giardia, cried is Cryptosporidium, strongly is Strongyloids, and per vagina is Parahemolyticus vibrio. Give me a thumbs up. So this is the mnemonic if you want to learn. String test पे बहुत question आता है, but it is obsolete nowadays, right? Skin snip test is positive in onchocercis, right? Frankel skin test is done for toxoplasma. Batchman skin test is done for trichinella. Fairless skin test is done for schistosomiasis, right? And Scotch test or NIH swab test is done for Antropius vermicularis. ये सब तुम्हारे PYQs हैं. If you solve the past 5-year PYQs of various exams, you will find all these questions. In your options, multiple parasites are there. You have to pick these parasites. So I have compiled all important tests at one page. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. Everyone. Should I proceed ahead? Should I proceed ahead? The list is not ending. You have to learn the list. It is Viv test, Leishman test or Montegro skin test, Chopra antimony test, hair perforation test, Sabin and Feldman diet test. Kasoni पे बहुत बार क्वेश्चन आया है. Kasoni test is for hereditary cyst, echinococcus granulosus, and Charcot Leyden crystals. So please learn, at least read it for some time. The next list is in front of you. The next list is on some important antigens, the specific antigen on some parasites. So all parasites have their structure. This is the structure of multiple different parasites. Each parasite has some specific antigen on their surface. Specific antigen which can be detected with PCR, and we can detect specifically that parasite only, not this. So specific. So there are some specific antigen. So there is antigen number 65 present on Giardia lamblia. Galactose-lactin antigen present in Antropius histolytica. Now the list is endless. You cannot learn everything. जिस पे PYQ है, PYQ सिर्फ एक ही पे है इसमें. It is HRP2, that is histidine rich protein. HRP2 antigen in Plasmodium falciparum. This test is used to differentiate Plasmodium, the two type of Plasmodium, Plasmodium falciparum and Plasmodium, the two Plasmodium, Vivax and falciparum. So by falciparum have HRP2 antigen positive, but Vivax have this antigen negative. So this is how you can differentiate the two Plasmodium. It is a previous year question in your exam. बाकी किसी पे भी आ सकता है. The new question can be framed on anything. Even I cannot guarantee कि किस पे आएगा. The list is in front of you. So if you want to excel, you don't want to even lose even a single question, learn the list, at least read it before your exam. And if you find it, no ma'am, it's very difficult, it's beyond my scope, so leave it. At least learn HRP2, which is already a PYQ, it can be repeated anytime. So the list is in front of you. My job is to compile all the things together and present it in the form of a platter in front of you. Not to eat what things from the platter you want, you like, you eat that. The other things you can leave on the plate only. So the platter is in front of you. The platter contains everything, all the list at one place. That is the meaning of the platter, right? So whatever you like, you eat. Whatever you don't like, you just leave it, right? So that's your wish. So the list is in front of you. To learn or not, it's your choice. But yeah, this is the list of all important antigen. New question can be created on any of them at any time, right? So that's all about it. I guess that's all about it. Okay. Now, we have completed the general mnemonics of the entire parasitology. Now there are some specific things in the protozoa, specific things in the metazoa. Let me teach you some specific things in the protozoa. You already know the classification of the protozoa. What are the 5 classes in the protozoa? Who will tell me the 5 classes of the protozoa? I've already taught you the classification. Now the 5 classes of the protozoa. There are amoebas. I've told you the amoebas. Yes or no? I've told you the flagellates. I've told you the sporozoans. I've told you the ciliates, right? Ciliates. And the last is microsporidia. How to learn them? Many students may ask, ma'am, kaise learn kare 5 classes? Amoebas diagrams learn karo. Amoebas have pseudopodia. They are sleeper shaped. They do not have any fixed shape. Flagellates have multiple flagella. Sporozoa have spores. They have spores. Ciliates have cilia. And microsporidia have microspora. So spora and microspora together, flagellates and ciliates together, and amoeba, right? Yes, Afsana, very good. These are the 5 classes in front of you, right? Now they all have cystic stage in them. So all protozoa, they have cystic stage. So they have cystic stage inside them, right? They have 2 stages, cystic stage and trophozoite stage. So in most of them, they have cyst, they have trophozoite, it is compulsory. Only few protozoa don't have cyst. Learn the list. So tell me the name of the protozoa who don't have cyst. Cystic stage is absent in which protozoa? So these are the protozoa in which cystic stage is absent. You can see in these protozoa, the cystic stage is absent. Give me a minute. Let me flip. There is a lag, I guess. Give me a minute. So yeah, the mnemonic is in front of you. Protozoa with Lys or TVED. So protozoa, these are the protozoa with Lys or TVED. Okay, so the mnemonic is TVED. It is Trichomonas vaginalis. TV. E is entamoeba, right? ED. Okay, D is dientamoeba and E is entamoeba. Entamoeba and dientamoeba. So TVED is the mnemonic. Okay, what is TVED? Trichomonas vaginalis, entamoeba, dientamoeba. Entamoeba, dientamoeba, and Trichomonas vaginalis. These are the parasites. These are the protozoa in which cystic stage is absent. Only trophozoite stage is there. In पे बहुत MCQ आता है. Trichomonas vaginalis पे multiple time you will find this PYQ. Give me a thumbs up. So the next mnemonic is TVED. Protozoa with TVED. I don't know if TVED क्या होता है, but yeah, this is the mnemonic. You can make some other mnemonic if you have something else in your mind. The mnemonic here is TVED. So these are the protozoa in which cystic stage is absent. Let me write down the mnemonic. Just a second. In which cystic stage is absent, TVED is the mnemonic. Let's move ahead to the next mnemonic, right? Okay, smallest, largest we have already done. I'm not repeating it. Tell me the name of the protozoa which causes traveler's diarrhea. There are 4 protozoas which causes traveler's diarrhea. The mnemonic is ECG. There are 2 C. ECCG. ECG. Double C. So E is entamoeba, histolytica. G is giardia. G is here. What are the 2 C? Cryptospora, cyclospora, the 2 sporas. Give me a thumbs up. So these are the parasites which called travelers. ये सब तुम्हारे PYQ हैं. If you check the PYQs today from the parasitology, you will find all these questions. And you will find one by one, you just throw the mnemonic, answer is in front of you. You just throw the mnemonic, answer is in front of you. You don't have to apply your brains. Throw mnemonic, learn the full form of the mnemonic, answer is in front of you. You don't have to apply your brains for this. Give me a thumbs up. So these are the parasites which causes traveler's diarrhea. The mnemonic is ECG, right? Now tell me the name of the parasites which causes diarrhea in HIV. In HIV, the 2 spora. the two spora, crypto and iso, IC, whatever you say, IC spora, cryptospora, isospora. So two sporas are there. So they causes diarrhea and HIV. HIV patient में diarrhea mainly इनसे होता है. The two spora, cryptospora, isospora. The two sporas, IC spora, isospora, cryptospora. So ये हो गया HIV का. Right? Give me a thumbs up. So ये protozoa में से मैंने 3 important points बताए. What are the 3 important points? Tell me the name of the protozoa which do not have cystic stage. No cyst. Tell me the name of the protozoa which causes traveler's diarrhea. And tell me the name of the protozoa which causes diarrhea in HIV diarrhea. So 3 important MCQs I taught you in protozoa. Now I will come on metazoa, specifically metazoa पे आएंगे. So tell me cystic stage किसमें absent है? So the mnemonic is TVED. Okay, it is Trichomonas vaginalis, Entamoeba, Dentamoeba. Right, Entamoeba histolytica, Dentamoeba fragilis, if you want to know the full form. Right, traveler's diarrhea. Traveler's diarrhea का क्या था? Mnemonic. What was the mnemonic of traveler's diarrhea? Traveler's diarrhea का mnemonic क्या था? I forgot. ECG. The mnemonic is ECG, ECG. And HIV में sporas. The two sporas, IC, isospora, cryptospora. Right. So that is this is Giardia. This is Entamoeba histolytica, and the 2C. The 2C cryptospora and cyclospora. Everyone give me a thumbs up. So here let me write the sporas, IC, and here ECG. Everyone give me a thumbs up. So these are the 3 important mnemonics I have given you from protozoa. Let me start metazoa. In the metazoa, as I have told you, we have basically parasitome में 2 classes हैं. Protozoa are the unicellular one, protozoa, and metazoa are the multicellular one, right? So in protozoa, metazoa, these are the 2 main classes, unicellular and multicellular in parasitology. Everyone knows that. Protozoa में we have 2 stages, the cystic stage and trophozoite stage. I have told you the list of the parasites which don't have cystic, only trophozoite, remaining have both. In the metazoa we have 3 things. We don't have cyst and trophozoite. These are multicellular. ये unicellular थे तो cyst और trophozoite था. ये multicellular है. They have egg. First they give egg. Egg will grow. Egg will hatch. From the egg, larva will come out. Larva will come out of the egg, and larva will grow, and larva will convert into adult. In the adult, we have male, we have female. Male, female will fertilize together, do the sexual intercourse, do the fertilization, and again they will lay out. The female will give the egg. Female will become pregnant. Female will conceive. She will lay out the egg. So we have 3 things: egg, larva, and adult. Here, these are the basics you should know. ये तो सबको पता है ना. In the protozoa, you have cyst and trophozoite. You don't have egg, larva, and adult in protozoa. If you say, ma'am, what is the egg in protozoa, larva in protozoa, or adult form in protozoa, you are doing a blunder. You can't pass your exam. So metazoa have the 3 things: egg, larva, and adults. Protozoa have cyst and trophozoite. I guess everyone knows it. If you don't know, clear your concept, right? In the metazoa, let's talk about egg. Let's talk about egg. Eggs are of 2 types. Let's talk about the egg. Eggs पे mnemonic दे देते हैं. Of the metazoa, eggs of the helminth are of 2 types. Some eggs are yellow in color. Some eggs are non-yellow, transparent in color. So the yellow eggs are known as bile stained. The yellow eggs are yellow because they are bile stained. Bile is yellow in color. Bile stained eggs. And the transparent one are non-bile stained. This is the first classification of eggs you should know. So we divide eggs by 2 class criteria: egg. I'm talking about the egg of metazoa, not egg of protozoa. Protozoa don't have eggs, right? So eggs of metazoa, we classify them by 2 ways. The first way is classifying is the bile stained or non-bile stained. Some of them are bile stained, some of them are non-bile stained. The second way of classifying them is the saturation. We will see whether they are floating or not floating in saturated solution of NaCl. So basically we take a test tube. In the test tube or a jar, we fill it with NaCl, namak ka pani, NaCl saturated solution. We take NaCl saturated solution, namak pani ko ghol ke le lenge, and then we will put the egg here. There are 2 options: either the egg will float or the egg will sink. So we have to see in saturated solution of NaCl whether the egg is floating or whether the egg is not floating. Not floating means sinking. Of course, not floating means sinking. So we classify the eggs in this. So some eggs are coming here, some are here, some are here, some are. So for every egg, you have to tell me 2 things. Ma'am, the egg is bile stained or non-bile stained. You have to tell me that. And that's the same egg is floating or not floating in saturated solution of NaCl. This is how we classify eggs. Give me a thumbs up. So let me give you 4 mnemonics. 1, 2, 3, 4. That's it. So eggs are done. All the questions on eggs you can crack if you know these mnemonics. Give me a thumbs up. Okay. तो शुरू करते हैं कहां से शुरू करते हैं? वी विल स्टार्ट विद नॉन बाइल स्टेन। नॉन बाइल स्टेन, the mnemonic is neha, neha. Only 4 parasites, the 4 not parasites, the 4 metazoa to be specific, metazoa have non-bile stain, remaining all are bile stain. So neha में n is Necator americans and a is ankylostoma. ये दोनों साथ में आते हैं. Again and again telling you both of them are hookworms and they always come together. So Necator americans and ankylostoma duodenale, you may be knowing both of them are hookworms. E is Antrobius vermicularis and H is H. So neha, neha, neha is non-bile stain. Neha is not yellow. Neha is not yellow. Not yellow means non-bile stain. Learn like that. Neha is not yellow. Not yellow. It is non-bile stained X. Neha. Give me a thumbs up. Give me a thumbs up. Let me see और कहाँ गए X के. Okay. Neha या ahan. Whatever you learn. Either say Neha or you say ahan. ये तो non-bile stain का हो गया. The same four. Neha. Neha. Bile stain में what is the mnemonic? Remaining all are bile stain, but the important one, the mnemonic is TAT. So triple T A. Triple T A. A is Ascaris lumbricoids. Very easy. But 3 T's are there. So the 2 tinea, tinea solium, tinea saginata, and Trachura trachuris. Give me a thumbs up. Give me a thumbs up. So according to the X, we classify X, the bile stained one and the non-bile stained one. Tell me 4 X in each category, the important one. Non-bile stained are Neha. Learn Neha or ahan, whatever. Bile stained are TAT. T-A-T-T TAT. So 3 T and 1 A. You should know the full form. The full form is more important. Everyone give me a thumbs up. Everyone. So बहुत questions आते हैं. You can't imagine. Necator americans, okay. Ankylostoma duodenale, H. nana, Antrobius vermicularis. Everyone give me a thumbs up. Bile stain में the 3 T. Tinea, Solium saginata, Ascaris lumbricoids. What is the last 3? Trachinella trachuris. That's it. Everyone give me a thumbs up. So ये हो गया bile, non-bile. Now the saturation, non-saturation वो end में है. ये अभी मेरे पास नहीं है. Okay, let me see if it is there. I will give you. Yeah. So the X which do not float. Float वाले भी हैं क्या? So X which float in saturated solution of NaCl. Float. Float का mnemonic है fertilized egg of Ascaris. What is the mnemonic? Fertilized egg of Ascaris trirate हैं. तैरते हैं. Okay, they are floating now. Do you understand Hindi? हिंदी में फ्लोट का मतलब होता है तैरते, तैरते, यू नो, स्विमिंग, तैरते. सो फर्टिलाइज्ड एग्स ऑफ एस्करिस तैरते हैं. दिस इज द mnemonic. ओके, सो फर्टिलाइज्ड एग ऑफ एस्करिस में से फर्टिलाइज्ड एग ऑफ एस्करिस हो गया ये एफ, राइट. फर्टिलाइज से याद आना चाहिए फर्टिलाइज्ड एग्स ऑफ एस्करिस. ई से याद आना चाहिए एंट्रोबियस वर्मिकुलरिस. ए से एंकाइलोस्टोमा ड्यूडेनेल, टी से ट्राचुरा ट्राचुरिस एंड एच से एच नाना. फर्टिलाइज्ड एग्स ऑफ एस्करिस, फर्टिलाइज्ड एग्स of Ascaris तैरते हैं. So this is the mnemonic. Fiat is the mnemonic. You can learn fiat or you can learn fertilized eggs Ascaris तैरते हैं. Whatever you say. So this is the mnemonic for तैरते, like swimming. Non तैरते वाले बताओ. Non floating. The non floating is suit. S-U-I-T. S-U-I-T. So what is S? S is both Solium saginata. I guess yes. Both Solium and saginata. Right. दोनों टीनिया हो गए. Right. U is unfertilized eggs of Ascaris. So unfertilized eggs of Ascaris they do not float, but fertilized eggs of Ascaris they float. इसमें बहुत क्वेश्चन आता है, बहुत क्वेश्चन आता है. I is intestinal flukes, all intestinal flukes. How many intestinal flukes you know? I guess intestinal fluke I know only one, fasciula busci, is it? Yes. And T. Okay, I'm sorry. Suit में I जो था वो strongyloids था, and T is both tinea. You got my point? Okay, let me summarize. Let me give you the summary of egg. Everyone take your notebook and note it down. Egg को divide करो based on staining, bile or non-bile, staining, bile stained and non-bile stained, right? And divide करो whether they float in NaCl or they do not float. The one which float, the one which do not float. Tell me the 4 mnemonics. Who will tell me the 4 mnemonics? Afsana, Education Channel, Dr. Rinku Raita, Harpreet, anyone else who's watching me live. Tell me the mnemonic for bile stained. What is the mnemonic for bile stained? It is TAT. What is the mnemonic for non-bile stained? It is NEHA. NEHA or hand. What is the mnemonic for float? Float मतलब तैरते. So fertilized eggs Ascaris तैरते हैं. Fiat. Fertilized egg Ascaris तैरते हैं. Fiat. Non-float suit. S-U-I-T. Everyone give me a big thumbs up. Now to learn the full forms, it's your job. I have simplified the job for you. I guess I have simplified the job for you. So here I have given you many mnemonics today. I would like to stop now because after 3 minutes I am having next lecture. Let me announce my next lecture. Give me a minute. So thank you very much for being with me. I really enjoyed teaching you mnemonics. Hope you have learned a lot of mnemonics today. Let me do my further announcements. So thank you very much. And yeah, my next lecture is at 10 o'clock sharp right now. Right, after 3 minutes, after 5 minutes at 10 o'clock, join Unacademy Learners app. It is a free lecture like YouTube only, but the only thing, the lecture is not YouTube, it is on the Unacademy Learners app. So install the app for the newcomers and watch me live there. You can, the lecture is free. The only thing you require a code to unlock it. The code is my surname Sachdev, Sachdev, Sachdev 10. Use this code to unlock any free lecture on Unacademy, even my and other educators also. So you can unlock any free lecture on Unacademy using my code Sachdev10. Please distribute it to everyone. And right now also you can unlock my lecture at 10 o'clock. I am going to teach you image-based questions of entire pathology. I will start with genital system and move on the breast and move on other systems. So please join me there. This is a list of free tests Unacademy conduct. So this is the test today. You can participate in the test using the same code Sachdev10. All India mock test NEET PG 2022 going to be conducted on Unacademy on 1st May 9 a.m. Set your reminders. Use code Sachdev10 to participate in the test, and I want all the students to participate. It is an all India rank prediction test, right? Everyone participate using my code. It is a free test, right? The best thing of today is that today is the last day to grab this offer. If you take any of the Unacademy subscription today before 12 a.m. midnight, you will get 20% off instead of 10%. So these are the various subscription plans plus Iconic, Light, MBBS first year. If you use my code Sachdev10 before payment on any of this subscription, you will get 20% off instead of 10. And today is the last day of this offer. So please grab the opportunity. Note down the code SACHDEV10. So if you are thinking of taking subscription in next few days, take it today only if you want to get this offer. Thank you very much. Join me on the app. Bye.